Nobody else gets to see this. Okay, no, that one. Yeah. Good idea at the time, Jenna. She hit it. We're overworked. In terms of good to broadcast. Okay. Are we going to stand up or? No. All right. Good morning, everybody. Welcome to our virtual conference. There are 290 of us on our district logged in this morning to have what I hope is going to be a brilliant day. The conference is Domestic and Family Violence is Everybody's Business. So I wanted to hand over to Auntie Maddie to start us off.
Hello everybody, my name is Madeline Donovan. I'm an elder from the Dungari Nation and also from the Gumbaynggirr Nation. I'm here to do the welcoming today. I would like to welcome you all to Dungari country, the traditional owners of this land upon which we meet, and I also acknowledge the land that you are all attending from today. I would like to pay my respects to elders past, present and emerging, and acknowledging at this time all Aboriginal people who are present from whatever land they have travelled and join us here today. I affirm my understanding that it always was and always will be Aboriginal land. Our sovereignty has never been ceded. Thank you.
Thank you, Auntie Maddie. Today is the 25th of November. It's day one of 16 days of activism. I just wanted to talk a little bit about what 16 days is. In 1960, 3 sisters were murdered in the Dominican Republic by a dictatorship. They were targeted because they were opposing the systematic oppression and violence against women and girls. They're known as the Mirabelle Sisters. Today has since been known as the International Day for the Elimination of Violence Against Women and Girls. 16 days of activism goes through to the 10th of December, which is International Human Rights Day. And this recognises that domestic and family violence is a violation of human rights. We are still losing 1 woman on average per week to domestic and family violence. It's not just in 16 days that we raise awareness, but for this time we want to take this opportunity to have this forum and launch our flowchart resource to give you the tools that you need to do your work and to support your clients to be able to establish safety and freedom. I'd like to just remind everybody, given the rates of domestic and family violence in our community, that there were people in our audience who have a lived experience of domestic and family violence. I want to take the opportunity to pay tribute to their survival. I also want to pay tribute to the women and children and other people that we have lost along the way. I'd like to remind everybody to practice self-care, and I'll do a plug now for 1-800-RESPECT, which provides 24/7 support and counselling for people experiencing domestic and family violence, but also provides support and consultations for people in the field who are working with their community to support people at risk. I'd like to now pass over virtually, as is the nature of the day, to the New South Wales Police. We have Detective Acting Superintendent Mr. Greg Thomas, who has a message for us all today.
Good morning, everyone, and thank you for the opportunity to open the North Coast Domestic Violence Online Forum, which coincides with the commencement of 16 days of activism against gender-based violence. I'd like to acknowledge the dedicated staff from Marina, Samaritans, Liberty and Blue Sky for their ongoing work on domestic and family violence and in arranging this regional forum and the accompanying flowcharts. 2020 has been a challenging year for everyone, but I'm particularly pleased to see the ongoing commitment and teamwork between our organisations in combating domestic violence. I hope each of you enjoy the conference and participate freely. Thank you.
Now we'd like to hand over to a very short film called Follow My Lead by the Insightly Exchange. This film is very symbolic of how we feel is important to work with victim survivors of domestic violence, and we hope that you enjoy it.
Follow My Lead is a resource that speaks from the voices of people with lived experience of domestic and family violence who need professionals and their social networks to be more prepared to respond in ways that uphold their dignity and build on safety.
How you respond to me when I share with you, and in the time that follows, matters significantly to me. I might tell you parts of my experience to test out how safe I am with you, and to explore how you react or retreat. I'll be looking to see what you think of what I have shared, that you believe me, whether what you think of me has changed and how, whether you give more weight to what the person abusing me says than what I say, and what this means next. Being safe is no simple or single decision or task. Are you prepared to respond safely if I share with you? A good first step is to learn more about my world. This is a map of my world. It's complex. I know you want to help, but if you oversimplify my world so that you feel you can understand, you lose sight of my challenges and my capacities. Come with me to watch my world build. I am a unique person with rights and responsibilities. I exercise choice. But violence and coercive control limit my options. I have my own sense of what is important now and in the long term. I am always aware of the actual and possible responses of others, from professionals to friends and family members. These responses inform how or if I reach out to others. Where I am changes the risks I face. These risks change over time and can change rapidly. The status of my relationship matters. It creates different levels of risk, threat, and consequences for my dignity and well-being. Just as every person is unique, the violence I experience is unique. Domestic and family violence is an injustice. It compromises my safety and undermines my well-being across many areas of my life, as well as the dignity and well-being of the people I care for, and who care for me. I may experience supportive, unsupportive, or oppressive systems and environments. My race, gender, sexuality, class, immigration status, ability, age, and other factors influence the circumstances of my life. I resist and respond to the violence, discrimination, and oppression I experience. I do this in ways that are visible and less visible, but this resistance and my responses to violence are important to me and part of upholding my dignity. Please recognise that I am already active in resisting the violence, building safety for myself and others, and managing risk. Please remember there may be much more going on than I care to say until I know you're safe to share with. If you try to make decisions for me and tell me what to do, I might feel more unsafe than before I shared with you. Please listen to me and follow my lead.
The full version of Follow My Lead is available online at Insight Exchange. Insight Exchange centres on the expertise of people with lived experiences of violence and gives voice to these experiences. It is designed to inform and strengthen social, service and systemic responses to domestic and family violence.
Hello everyone, I'm Naomi from Blue Sky Community Services. Good to be here, and I'd just like to acknowledge Annie Maddie and thank you for your welcome, and acknowledge we're on Dunghutti country. Thank you for joining us today for the Domestic and Family Violence is Everyone's Business online forum. We're really happy to be here. We thank Samaritans for hosting us for this live stream. They've done just such a great job. This forum was originally conceived by the District Homelessness Implementation Group, which is facilitated by the Department of Communities and Justice, and whose membership includes specialist homelessness services and other housing-related services. Alongside of this, this development, a need was recognised in the child and family interagency meetings on the Mid-North Coast for there to be a flowchart for services to be able to better support their clients who are experiencing domestic and family violence. My role as Sector Development Officer with Blue Sky Community Services was to facilitate the development of the flowchart, working alongside the DV Specialist Services and as a conduit to the child and family interagency members. These members brought a wealth of knowledge and ideas to the flowchart, and together we were able to create a pathway for people to follow when supporting families to safety. The DV flowchart, the 5 Rs, was the outcome of this collaboration, and we will be officially launching this today. And I hope you've all been able to open the flowchart, which was sent to you with your registration, and you can be following along with that. We've at the moment got the Coffs Harbour version, and the other versions are hoping to go up today, so you'll be able to look at all the other areas as well. This was a collaboration between all of these services, and we thank everybody who was involved. The forum follows the structure of the 5 Rs in the flowchart, and we hope you can gain greater insight today into this document and how you might be able to use it to support families you work with. The forum has been led by 3 Mid-North Coast Domestic and Family Specialist Services, Warina, Liberty and Samaritans, with essential support and advice from the Mid-North Coast Local Health District, Mid-North Coast Department of Communities and Justice, New South Wales Police, from the Coffs Clarence Local Area Command Police, and Blue Sky Community Services, and the Coffs Coast Committee Against Domestic and Family Violence. It has been a truly wonderful collaboration. We are capable of so much when we work together, and I also want to acknowledge all the individuals who made this happen today. So thank you, and please enjoy. We're now going to view the short film that was made. So this film will sit on our websites alongside the flowcharts as an extra resource for people to be able to watch. So I hope you enjoy the short film. We are pleased to introduce you to this local initiative developed to support our community partners who are working with children, young people, individuals and families across the Mid-North Coast who are experiencing domestic and family violence. We would like to acknowledge a Child and Family Interagency who provided invaluable insight to the amazing work they are doing every day. The result of this collaboration is the Domestic and Family Violence Flowchart, the 5 Rs, which are recognise, assess risk, respond, refer and restore. Domestic and family violence is everyone's business. The Domestic and Family Violence Services cannot do this work alone.
The first step is to recognise. Domestic and family violence remains at unacceptably high rates across all of our communities on the Mid-North Coast, with 1 in 3 women experiencing domestic and family violence in their past or present relationship. Due to increased conversations in our community about domestic and family violence, more and more people are feeling safe to come forward to disclose what's happening for them in their homes. In your role, this means that you might find that more of your clients are feeling safe to talk to you about the support that they need to become safe. Domestic and family violence does not discriminate, so it's important to be alert to some members of community who might be more vulnerable than others. This includes people who experience a disability, young people, children, those from migrant and refugee backgrounds, and the LGBTIQ+ community. In your role, you might find yourself working with somebody who has been using domestic and family violence in their relationships. For example, you may be working with a client who discloses they've been excluded from their home due to an AVO. In these situations, it's important to know that your role can really make a difference to the safety of women and children.
The next step is to assess risk. The state government recently introduced legislation to introduce the Domestic Violence Safety Assessment Tool. This was in order to create a common language around threat and serious threat experienced by our client groups. It is important for you to be familiar with your policies and procedures, as well as any risk assessment tools you use within your own organisation. It's so important for us to remember that clients are the best judge of where they're at in terms of their safety. Whether they decide to remain in the relationship or whether they decide to leave, it is important that we always let them lead in building a safety plan, no matter what the outcome. You can always make contact with your local domestic and family violence specialist service or 1-800-RESPECT to get guidance on how to move forward and respond to the risks that you've identified with your client. Please also keep your supervisors in the loop and get support, because it can be a really confronting space to work within.
Once you have identified that your client is experiencing domestic and family violence and you have explored the risk, it is important to respond accordingly. It is crucial to understand that domestic and family violence is life-threatening, and you may be required to contact the police or the Child Protection Helpline if you think someone is at risk of significant harm. Be led by your supervisors and your workplace policies and procedures. Children and young people who live in homes where domestic and family violence are present are not bystanders to the violence. We know they can have long-term effects, including youth homelessness, poor physical and mental health, and challenges at school. Be the voice for children and young people and make sure to advocate for their rights to safety.
The next step is to refer. With DV being so prevalent in our communities, now more than ever, it's important that we work together in a coordinated, collaborative, multi-agency response. When referring to other services, it's important that you stay involved with your client. They are the ones that put trust in you in disclosing the domestic and family violence. Domestic and family violence specialist services can actually work behind you as the caseworker, providing guidance, support and resourcing to a case plan where you're working towards safety. Before referring to a domestic and family violence specialist service, perhaps consider the things that you could already get started on with your client. This might be an application to victim services for immediate needs or counselling, going into Centrelink to change their details or find out what they're entitled to. You might even be able to see if you can go to Housing New South Wales and start an application for a product such as Start Safely that the client may be eligible for. Domestic and family violence is the largest contributing factor of homelessness for women and children in Australia. Crisis accommodation is limited and in high demand. What we'd also like to express as specialist services is that communal living is not for everyone. People with unmanaged mental health or unmanaged drug and alcohol issues need a more tailored and individualised response. In addition to your local crisis accommodation service, there are other supports available. These are through DV Line, Link to Home, or your local housing provider who can assist with temporary accommodation. Please know that by working together, communicating clearly, and working toward the client-led goals means that we can achieve safety for women and children in our communities.
The final step is to restore. Your safety and well-being is paramount. When working with clients who are experiencing domestic and family violence, it is normal to feel a range of emotions and concern for their safety and well-being. When a person chooses to remain in a violent home, it is also normal to feel frustrated, concerned and worried for their safety. In these cases, remember that it can take between 7 and 13 times to leave a violent relationship. And statistically, this is the most dangerous time for women and children. Please know that by keeping the door open, making sure clients know that they can come back and see you, and having conversations about safety makes a difference. Keep supporting them, give them control to make decisions, to engage support for them and their families. Make sure you debrief, have support from your manager or supervisor, and practice self-care.
Please always reach out to your local domestic and family violence specialist services for support, advice and consultation. We hope that this relationship, alongside the additional information on your local flowchart, can help build knowledge, resources and capacities within your own service. Now I'd like to introduce you to the first R, recognise, and we're going to start that session by introducing local legend and Paramgulbangia man, Lachlan Skinner. He's going to talk a bit more about the work, the collaboration between Warina, the local Aboriginal Lands Council in Coffs Harbour, and One Mob Radio to produce the 16 Days of Activism podcast series.
Should I talk now? Yeah. Ginaganya Jarwin, it is Lockie Skinner here. I'd like to start by saying, Ginagay, I'd like to pay my respects to elders past and present of I'm on Gadigal country at the moment. In Sydney, I'd like to acknowledge Dunguddi country where the webinar is being held, and Coffs Harbour, my home grounds, Gumbengi. So I'm the founder of One Mob Radio. It's a First Nations media platform, the first one for the Coffs Harbour area. It's been amazing. We launched last week, and it's just really about celebrating our people, stories, achievements, and culture. As a proud Gumbengi man, I started community radio 10 years ago, and I was looking at I really always wanted a First Nations media platform, and it was just awesome to be able to have so much amazing support. We've got a good partnership with Koori Radio and stuff like that. So, it's One Mob Radio. You can find it on onemobradio.com.au. You can find it us on social media, Facebook and Instagram. So our partnership with Warina has been incredible. Taryn came to me a little while back about, the idea of podcasting was brought up at a meeting prior, and I guess it just sort of built into something that was really cool. And I thought it was such a great idea, but I didn't and I knew it was going to be powerful, but I had no idea. Once I've now listened to, I think we've got about 8 or 9 podcasts at the moment, listening to them back, it's just really powerful stuff, and it is really amazing. So this morning on the breakfast show, we promoted the first podcast that came out. So our podcast will be available on Apple Podcasts, Google Podcasts, TuneIn Radio, Spotify, and it's just talking to people who have experienced domestic and family violence or work within the area of domestic and family violence. So, it's been really great. Warina's been really supportive in organising people to have chats to, and I think it's really nice the way we've done it, because it was their support worker and the client doing one-on-ones in a number of the interviews. I sat down with Charlotte in the first podcast to have a quick chat, and then there's been a few that I've popped on, but I really just wanted to leave it to be able to have that support worker and client sort of relationship on the podcast, and I think it's come across really nicely, and I think it just allows that individual to feel a little bit more comfortable in the space of talking about it, because I could only imagine it would be very difficult sort of reopening that thing. So I don't know how long I have to talk, but I think I'm done. Is there any questions? I don't know how that would work.
Okay, now we're just playing with the fun technical stuff up the back, and we're looking forward to actually playing a podcast. So it should be coming through any moment.
Oh, just on that one quickly before we do it. So this is our second episode that will be released tomorrow. This one is with a client. And I think this is a really nice, I really like this one. This one's really good. So, enjoy. In these podcasts, we discuss sensitive issues that surround domestic and family violence, including physical, sexual, psychological, and emotional abuse. These podcasts may trigger some people who have been victims.
One Mob Radio! Coming out the other side of family and domestic violence. Stories of survival, recovering from trauma, the benefits of reaching out and the importance of shattering the silence and stigma. Family and domestic violence can happen to anyone in any relationship. It occurs when one person in the relationship makes another feel unsafe. Perpetrators of family and domestic violence often use tactics of power and control, as well as physical, emotional, verbal, sexual, financial, and cultural abuse. Family and domestic violence often leads to a repeated pattern of abusive behaviour that leaves people feeling scared, unsafe, helpless, unvalidated, and vulnerable. Ending relationships characterised by family and domestic violence is a huge feat, as women and children are often faced with a number of questions. Where will I live? How will I get money? What will people think of me? Do people think I'm making it up? What if he finds me? Although there are support services available to women and children when they leave violent relationships, the road to recovery can be long and arduous. In this series, you will hear from a number of survivors who have come out of the other side of family and domestic violence. They bravely open up about their stories of survival, experiences recovering from trauma, the benefits of reaching out, and the paramount importance of shattering the silence and stigma. I am a caseworker at Barina Domestic and Family Violence Specialist Services here in Coffs Harbour, New South Wales. I'm here with a client of mine, and I'll now let her introduce herself.
My name is Sam. I'm a single mum of 2 children. I have a small business and I live in the Coffs region. I left a domestic violent relationship just over 2 years ago.
Can you talk a little about what your life is like now compared to what your life was like when you were in that relationship?
My life over the last 2.5 years has changed dramatically since leaving my 10 years of a controlling, emotionally abusive relationship. Not all of the 10 years was bad, but towards the end it was unsafe and it was time for us to leave. I always worried that I would damage my children by moving them out of their family home and having separated parents. I was also worried what people in the town would think of me, but it became more aware to me that they would become and enter another generation of abuse if I didn't remove me and the children from the situation. Life to begin with was really anxious and stressful, but after 2.5 years I look back on how far we've come and I thank God every day that I was brave enough to walk away.
The impact of emotional abuse is difficult to recover from because it often attacks your sense of worth. What are some of the things you do for yourself these days to show yourself love and care?
I try to surround myself with positive and kind, supportive people. I do use my weekends with no kids to fill up my cup with the things that I love to do. I'll get up early and go and watch the sunrise. I took up going to the gym. It helped me mentally to cope. It's so important after going through what you go through to reconnect with what is good for your soul.
Since the relationship has ended, what has the journey of recovery been like for your children? Have you noticed changes in their behaviour since the relationship ended?
The journey for my children has been a lot more positive than I ever thought it would be. They have to see their dad 8 nights a month. They do still come home unsettled sometimes because they are often made to deal with adult issues. But I always make sure that their first night back consists of an easy dinner, a lot of love and support, and generally an early night. Over time, I've come to notice that when they wake up the following day, so on the Tuesday, they'll come much calmer and settled again. Children are far more resilient than what we give them credit for. They just need a loving home and a really good support system.
There is currently a petition to criminalise coercive control. a common feature of violent relationships. What are some other things you want to see changed so survivors of domestic violence are better understood and supported?
For me, there are a lot of things that I would personally like to see changed. Even with the domestic violence death rates are still so high, I do still feel like there is not enough, or there is not enough, and they're still not doing enough to help protect victims and their children. Since leaving, I personally had abusive messages, stalking, slandering of my name, yet every time I personally went to the police, they made reports, but still it was never deemed enough for a domestic violence order and AVO. I would be asked, did he hit you or hurt you? Has he threatened to hit you or hurt you? And because my answer was always a no, it was as though it was deemed not as severe. Seeing the story of Hannah Clark in February, I just remember crying. It affected me so deeply because I related to her life so much. And I guess you just never know what a person is capable of until something as tragic as that can happen. The system, I feel, needs to change and become more aware that abuse comes in so many invisible forms to the public eye. It's not always a punch to the face or something like that.
What messages do you want to give to people living in family and domestic violence?
For anyone currently living in domestic violence, all I can say is I know how scary it is to consider leaving. I know you can feel embarrassed or you can feel like people aren't going to believe you, but seek help. Even if you don't have a big support system, find a women's refuge or anyone that you can chat to. You can leave and you will be okay eventually. No one deserves a life where they feel scared or intimidated or not worthy. If you have children, you deserve to show them that we can be strong and brave. You are worthy. Your life is worth fighting for.
Thanks, Sam, for sharing some of your story. I'm sure it'll empower others who may currently be struggling in a domestic and family violence relationship.
Sorry, I just need to compose myself for a second. Thank you so much to Lockie and to One Mob Radio, and for the client who bravely shared her story. It's giving me goosebumps, so I might, on that moment, I'm going to move on. We'll move on to the next session. Now we're ready to introduce Jeanette Cormack from New South Wales Health. She is the District Manager of Integrated Child and Family Wellbeing Development. Jeanette, we'll get the live stream of Jeanette just in one tick.
Good morning, I'm Janet Cormack, the Mid-North Coast Local Health District Manager of Integrated Child, Youth and Family Wellbeing. My team has strategic responsibility for the violence, abuse and neglect services delivered by health. We are committed to developing comprehensive, integrated, trauma-informed, psychosocial and medical forensic service responses to those affected by violence, abuse and neglect. This morning, I look forward to talking with you about the health impacts of domestic and family violence and the role of local public health services. First, I would like to acknowledge the traditional owners of the land we are meeting on and remind people that we are on Aboriginal land. I acknowledge and pay respect to the elders and in particular those attending today's event. I am joining you from Gumbaynggirr land. Aboriginal women and children are disproportionately affected by domestic and family violence. The rate of reported domestic violence-related assaults for Aboriginal females in New South Wales is 4 times higher than for the whole female population. And a reminder, don't forget the kids. The Centre for Disease Control and Prevention have reported that in homes where violence between partners occurs, there is a 45 to 60% chance of co-occurring child abuse, a rate 15 times higher than the average. Even when they are not physically attacked, children witness 68 to 80% of domestic assaults. These numbers are a sobering reminder of the toll a violent environment takes on children. Research shows that children who live with domestic violence can develop psychological, emotional and behavioural problems. The Centre for Disease Control, through the Adverse Childhood Experiences study, found that children who witness abuse are at greater risk of alcohol and substance abuse, health conditions like cancer, depression and diabetes, poor performance in school and an early death. We know the prevalence of domestic and family violence in Australia. 1 in 6 people have experienced violence by an intimate partner. That includes 1 in 4 women and 1 in 13 men. On average, 1 woman is killed every week by an intimate partner. Intimate partner violence contributes to 5.1% of the burden of disease for women aged 18 to 44 years. Women experiencing violence are at risk of stress, anxiety, depression, phobias, eating disorders, sleep disorders, panic disorders, self-harming and suicidal behaviour, low self-esteem and post-traumatic stress disorder. In 2018, Brain Injury Australia delivered the first evidence-based study of prevalence of brain injury due to family violence. 2 in 5 victims who presented to hospital due to family violence sustained a brain injury as a direct result of the violence. We know women's exposure to violence is strongly associated with the adoption of risk behaviours that further affect health, including problem substance use, alcohol abuse, physical inactivity and smoking. Women affected by violence need more surgeries and spend more time visiting doctors and staying in hospital. They are more likely to use medication for depression, and violence during pregnancy is associated with miscarriage, late entry to prenatal care, stillbirth, premature labour and birth, fetal injury and low birth weight. Women may present to healthcare settings before they present to criminal justice or social services agencies, and if abuse is identified, they can receive interventions that increase their safety and improve their health. Aboriginal women are 32 times more likely than non-Aboriginal women to be hospitalised due to family violence injuries. In fact, up to 90% of Aboriginal women in prisons are survivors of domestic and family violence and/or sexual violence. 1 in 5 women killed by a male partner identified as Aboriginal. The health sector plays a vital role in addressing the issues of violence against women and their children. Health practitioners are the major professional group that women turn to for health needs, directly or indirectly related to the violence they have experienced. In Mid-North Coast Local Health District, routine screening for domestic violence forms part of normal medical history taking or assessment procedure for new clients at face-to-face contacts for all women attending antenatal services, early childhood health services, and women 16 years and over attending alcohol and other drug and mental health services. Our screening rate in Mid-North Coast is 93% for women where it was safe to screen. This domestic violence routine screen is an early identification strategy to provide women and children with support and connection to domestic violence specialist services. Safer Pathways Domestic Violence Safety Action Meetings are a key initiative to prevent domestic violence homicides and to provide a multi-service, coordinated, consistent, effective and proactive response to victims of domestic and family violence. Fortnightly local safety action meetings led by police are a key element in the development of referral pathways for victims at risk of serious threat. Health have a strong presence in these meetings. The health workforce, via the Domestic Violence Prevention Education Program, deliver community education and prevention on domestic and family violence. Health staff co-facilitate the Love Bites program, educating secondary school students in respectful relationships, addressing domestic and family violence and sexual assault. Our emergency departments are crucial points in the health system for identifying domestic violence. Women who are abused are frequently treated within healthcare systems. However, they generally do not present with obvious trauma, even in emergency departments. Direct questioning is particularly important when there are physical, emotional and behavioural signs of domestic violence, which may have not been disclosed by the woman. Mid North Coast Health District is piloting screening and response for domestic and family violence in emergency departments. The pilot will offer the widest scale of domestic violence screening of its kind in Australian emergency departments, and all women aged 16 and above presenting to the selected pilot sites as patients will be asked short questions on whether they have experienced physical, verbal or emotional abuse by her current or former partner. If a woman is identified as experiencing domestic violence, a psychosocial health worker will speak with her to better understand her situation and needs and any concerns around her wellbeing and safety. Every woman who is identified as experiencing domestic and family violence will be offered a psychosocial response. She may also be provided further New South Wales Health Services based on her needs or be referred to domestic violence specialist services. As part of the risk assessment, health workers will also ask if there are any children in the home who may have witnessed or been impacted by the domestic violence, and appropriate safety responses will be made. The aim of this project is to increase the screening and identification of women who are experiencing domestic violence and provide them with support. The program is important in this setting as prevalence of domestic violence is higher among emergency department users than the general population. The pilot is an early identification and intervention strategy to promote awareness of the health impacts of domestic and family violence. Outcomes of this pilot will inform the view of expanding into a statewide approach. In addition, Mid North Coast Local Health District has a Working Together to Stop Violence strategy and a policy to support health staff experiencing domestic and family violence. They have 10 days of special leave to attend appointments without having to use up their sick or annual leave. Support is given in the workplace to ensure victims stay in employment and that their safety and emotional wellbeing is provided for. Mid North Coast Local Health District show commitment to the 16 days of activism by engaging secondary school leaders in events across the district to discuss gender-based violence. We have also partnered to deliver innovation and research with Southern Cross University, Department of Premier and Cabinet and Northern New South Wales Local Health District to fund a PhD scholarship for a research project to build a localised evidence base to inform decisions about future actions to address domestic and family violence on the North Coast, identifying domestic and family violence hotspots, antecedents and process pathways. The outcomes of this research are due for release in 2021. Prevention and response to violence, abuse and neglect requires a whole of government and whole of community response. No single service or service system has the capacity or expertise to respond to the needs of every client. Many clients engage with a range of services during their lifetime, and the needs of people and families who have experienced violence, abuse and neglect will have to be met by working in partnership with services, both within New South Wales Health as well as with services outside of health. These include, but are not limited to, those provided by other government departments, such as Police and Department of Community and Justice, non-government organisations, such as Domestic Violence Specialist Services, and other healthcare providers, like general practitioners. Domestic violence is everyone's business. Domestic and family violence is a global problem of pandemic proportions. The health impacts are serious and long-lasting, but most importantly are preventable. Primary prevention approaches have been successfully applied to many other health problems. Preventing violence against women is possible if we draw from other public health strategies. Look what we have been able to achieve in response to the COVID-19 pandemic. We are the movement. Collectively, together, we can stop domestic and family violence. Thank you.
Thank you very much, Jeanette. Now we're moving on to the risk part of the agenda. I'd really want to offer a warm welcome to the Department of Communities and Justice, to Vaughan and Sarah, who are going to talk about how domestic and family violence impacts children. And I want to express my thanks to the DCJ workers who work tirelessly to advocate for the rights and safety of young people and children.
Thanks for having us. I'm Vaughan Higson. I'm a Manager Client Services within Mid-North Coast District, currently sitting at Tari CSC. And with me I have...
Sarah Cooper. I'm a casework specialist and I cover Tari and Port Macquarie, and my role is supporting caseworkers and managers with regards to undertaking assessments and working collaboratively with families.
So like we just introduced, thanks so much, we are going to be talking about domestic and family violence and child protection, and really trying to keep the focus on the child for a child protection agency. And I think we know that domestic and family violence is everybody's business, and with lots of services supporting people who experience violence, our focus is supporting the children who live with that violence every day. So this should hopefully work. All right. But I would firstly like to start by acknowledging that we're meeting on traditional Aboriginal land. Sarah and I are on Biripi land today in the Port Macquarie area, but really want to pay my respects to elders past, present and emerging, and extend that respect to Aboriginal colleagues in the room with me today, as well as streaming online with all of us. Working for DCJ, I can't acknowledge the past practice that we as an agency did to Aboriginal children and families, and really stripped them of their dignity in decisions that were made and our past policies as an agency. And really today is an opportunity for us to show everybody that we as an agency and us as Mid-North Coast District are really committed to not repeating those past injustices, but really being aware of the impact that we as an agency had and continue to have on the lives of the Aboriginal families that we work with. So, a really brief outline of what our discussion will be today. We really want to look at, and it goes with the theme, the importance of working in partnership with DCJ agencies, community and families when looking at domestic and family violence. We know there's no one size that fits all and we all need to work together. Part of that involves mandatory reporting, what it looks like and how this can actually impact on our potential involvement with the family. So what should be included in a report and what actually can influence a decision on whether something gets allocated for a response or not. Sharing the risk, whose responsibility is it? And then really, for us, the importance of the language used in addressing the current and future impacts of domestic and family violence, not just with the family and children, but with community as a whole. So who are we? Like we said, so we sit within Mid-North Coast District. There's 4 community service centres across the district, from south up to north. So Tari, Port Macquarie, which includes the Mid-North Coast Child and Family District Unit, that's responsible for supporting all the NGOs with kids in care that hold case management for those children. Kempsey and Coffs Harbour. So we are a relatively small district, but we know we are a busy district, and we have a really large proportion of Aboriginal children and families within all areas of our district. Actually, it's not one more than the other, it's spread throughout. So when we're thinking about mandatory reporting, that's just the link for everybody to know, and people that have been using the mandatory reporter guide would know that it has been updated. It's much more user-friendly and really can support guiding the information that's provided to the helpline. So when we're thinking about reporting, what we need to see really that supports the decision whether something gets made or not is really what we're seeing, what we know, not just that there was a domestic violence incident, but we want to know who's doing what to whom, what the violence looked like, what's the severity of the violence, how the person being harmed responded, what do we know that they did, what did the kids do, were there injuries to anybody, what do we think the impact is on the children. And when we talk about that, it's equally as important if the children appear fine that information is included in the report as well. That can tell us a lot of things in terms of what their experience on a day-to-day looks like for them. If they're experiencing a violent event, somebody perpetrating violence against their mum or their dad, and that's normal for them. So that's really important to see that as well. The other thing is really important to include any discussions that you've had with the people involved and your plans moving forward. So what's been done, what do you think you're going to do, and what are the family, what are they going to do? We really need to think more about what domestic violence means rather than just saying there was domestic violence within the home or there was family violence within the home. We need specifics. That information, I think most people know, but if you don't, so that's taken to a weekly allocation meeting that happens across the state every week in every CSC. They're called different things in different sites. I know COFS, it's a service response meeting in terms of just being really conscious of the language that we're using in that space. But those reports that have that information that I just mentioned, we have much more impact than to a child. We don't need to go back for more questions. So what we find when we don't have that information is we might be contacting mandatory reporters or non-mandatory reporters seeking more information to clarify, which can then that can delay a response occurring from us. Don't underestimate the information that you bring. In those situations, more is more. The more information, the more specific you can have. That's going to assist in us making a decision.
It does, because also why it's important is Vaughan will talk a little bit with regards to the statistics with reports that are received from the Mid-North Coast, but that information you might not think is important around, there's an aunt or, Nan came to the home and supported, or there's now a no contact AVO. It is really important because it can influence on whether or not we allocate that family, and we want to be sure that if we are going to be involved at such a terrible time, when we get involved and unfortunately knock on families' doors, people are in the worst point of their life. Things are not going well. So we want to make sure that if we are going to be turning up and doing an assessment, we want to be there for the families and those kids that really don't have absolutely anyone else there. And if they do, then we want to work with the family to understand what might be getting in the way for them in regards to increasing some support. And like Vaughan said, our focus is very much on the child. And we'll talk a little bit later around how we are changing as an agency around where we place the responsibility for violence, so that we don't further harm mums and kids in the process.
Absolutely. So on those stats, which is really, we're doing these statistics, one, so you know what's in the place that we live and work. All of us live and work within the Mid-North Coast. So from across the whole Mid-North Coast district, so from Taree up to COFS, just from the 1st of July 2020, so this financial year, up until Monday, so this is current as until the 23rd of November, we've received 7,011 risk of significant harm reports across the 4 sites. That equates to 3,978 individual kids being reported at risk of significant harm from July to November. Over a quarter of those reports relate to domestic and family violence and or physical abuse. So for the numbers, that's 2,036 reports, or 1,558 children have violence-related issues as their primary reported concern. So that's why when we're talking about reporting, when we're talking about who does what and what can we do as community to support people experiencing and living with violence, we're really interested to know what you're doing as well, not just reporting. Reporting is absolutely necessary, and realistically, Sarah and I were just talking beforehand, with COVID-19 and everything that went along with it, we were really worried that reports would decrease. We know that domestic and family violence increased quite drastically, within our communities and across the state. But what we did see was an increase of reports. And that's because of all the services and community, and that sharing the knowledge, sharing the risk around domestic and family violence. We actually got an increase of reports from really April, May. And that's what we need to see. What we want to see is continued reporting, really focused on what's happening. So, this is our practice framework. So the New South Wales government has developed a new practice framework for casework, all practitioners working with children and families, to really guide our practice. So there's 5 main principles, and they talk about language impacting on practice, culture being ever present, critique leading to improved practice, relationships create change and restore dignity, and ethics and values integral to good practice. So they're our guiding principles, and there's endorsed practice approaches that we do. So we recognise that as an agency, we're really well intentioned and went out to try and do all these different things. Some were evidence-based, some were not, and then some were getting change, others weren't. So they've collated all the evidence and pulled that together. And they really talk about dignity-driven practice, which that really is just about response-based practice. So our response, what we do, is based on what we get back from the children and families. We obviously go in there with a plan of what we need to assess, because people aren't choosing for us to be in their lives. And like Sarah said, we're often there at one of the worst points in their life. So we are always really clear with what we're going out there to look at, but our responses are very different to what they may have been in the past. We then also look at family finding, and that's really about shifting that responsibility back from one person within the family, or actually us or community agencies holding that responsibility for a family, and really putting that back onto the greater family in terms of being able to problem solve that themselves, because we know that they do that anyway. So we're really acknowledging what's happening already and kind of being clearer with what the bottom lines are, with what we want to see, and how they get there is up to them to really come to that solution. We'll support them through that. So that's also very different. We absolutely focus on motivational interviewing and looking at the stages of change to where people are, and that really guiding how we approach people. It doesn't stop us working with people by any stretch of the imagination or addressing the risk, the safety and risk concerns, but that increased awareness actually supports us know where to tackle it. We look at safety-centred practice. That is also keeping the child at the centre, and then structured decision-making. So that's our tools that we use to support our decisions. Tools don't make decisions, people make decisions, but as an agency, we have structured decision-making that supports that decision-making process. So that's the gut. So Sarah, as she said, her role is all about influencing practice and implementing the practice framework. As a casework specialist, it's completely about practice support for everybody on the ground, regardless of what level, whether they're a brand new caseworker that's just started or whether they're a manager client services or a caseworker that's been around for 30 years. Sarah, there's 5 casework specialists across the district, and their whole role is around supporting us practitioners doing the day-to-day work.
And the caseworkers, I mean, this is, as you all know, it's really complex, and no one family is the same, and there's often other complexities or issues that sit within a family often at times, not just one thing. So caseworkers have a really difficult job every day to try and keep the child at the centre while working with services, and I hope that as an agency you are finding that we are being more collaboratively. We're working with agencies and meeting families where they're at, because caseworkers are absolutely trying, and so are we as an agency, to try and get that right. We've still got a long way to go, and we don't always, so please let us know, but we are really trying to improve the service delivery and response that we give children and families.
And we're realistic that the way that we're asking caseworkers and managers to work is very different to what community members think we do, as well as what our partner agencies have experienced from us in the past, as well as the families that we know that have been working with us before. When we tackle it a different way, we're going to get that resistance because it's not what they're expecting from us. So it really is about ensuring that that conversation happens so that we're all on the same page, so that we know where we're coming from and where the agencies are coming from. We know what the worries are so that we can then go out there with a joint approach to support the family.
And build some safety, often through trying to work with dads, which is something that we haven't done all that well as an agency. And that's a really hard job, and that's not kind of our specialty. We learn on the men's behaviour change program and experts in that, but also us taking what we need to know around that, so that in an assessment, because they are point in times, that we can, you know, maybe try and create some safety there within a family through dad who is choosing to use violence.
That's the big thing. So when the slide talks about language matters, and it really does, we, like Sarah was talking about, we've not spoken as a blanket rule. There are always pockets where people have done it really well, but as a blanket rule as an agency, we've never really addressed violence with men well. We know that violence is a gendered issue. The fact that I'm a man talking about men using violence isn't lost on me, don't worry. But it's one of those things that we really need to recognise. We also know that child safety is directly correlated to the safety of their mother, regardless of who's perpetrating violence against whom. So violence is a gendered issue for us in our society, and it is a choice. People choose to use violence because they also choose not to use violence. And they do that every day when they go to work or they go down the street, and then they might come home, and it's a choice. So that's also a different approach for us, rather than putting that responsibility on the woman, I'll say the mum in this case, because we're talking about it being a gendered issue, in terms of what can she do about the violence. Well, she's already doing a lot to keep herself safe and her kids safe in her eyes. We often don't recognise that either, and we know that it's not about, we know that doesn't always equal safety. It might increase risk, but we need to acknowledge that something's being done and kids are doing something as well. And we're really focusing on shifting that responsibility to talking to the person that's using violence, that's choosing to use violence. And the quote says, men's violence is not a problem of women's minds. The language of effects and impacts takes us there. So we need to actually acknowledge the impact that violence is having there. It's not made up. It's a very real thing, and people see it every day. Everybody online sees that every day. We really focused. We know that our language can neutralise the violence and clouds the responsibility. So that's when we're talking about, we really want violence that describes it as unilateral, someone using violence against somebody else, and attributes responsibility. So he often uses violence to punish his children, or he has a history of choosing to use violence against female partners, is very different to there was an incident of domestic violence and there's domestic violence between the parents. What we know is that wherever there's violence or oppression, there's resistance. That's what we want to explore, that's what we want to know, and that's where often our agency partners have that information, because you're engaging with the women in that space already. We know that that's when we're talking about resistance. Language of survival is not adequate. There's much more going on than just surviving violence. What are they doing? That's what we want to know. They don't want us to feel sorry for them. People that experience violence don't want us to feel sorry for them. They want us to listen to them. That's what we're really focused on doing, and really focused on what that means to the kids. What is the child experiencing? That helps us with safety planning, because it helps us understand what's already been tried.
Yeah, good. Are we still live?
We're still live. So that's it for us. Sorry that we've gone a little bit over time, but each of you know the respective. So Raylene McKinnon's the MCS in Coffs Harbour, Kylie Harrison in Kempsey, Christy Tansey in Port Macquarie, and myself in Taree. Reach out to us if you have any questions or want to work with one another. We're really keen to continue to build relationships with our agency partners. So thanks for your time.
Thank you so much. Well done. And if that's one takeaway you have today, please, I want to just echo the words of Vaughan there. Violence is a choice, and you can choose not to use violence. There are ways. We'll talk about that a bit further down on the agenda as well. I just want to give an update on the chat. The chat function is now working. You will have we have moderators, so you're able to use that function now. If there's questions that we can't answer, we will take it on notice and we'll give the answers out to everybody who's registered at a later date. But please, if you've got questions from the previous sessions or from sessions coming up, use that chat. We've got a team up the back of wonderful people ready to answer your questions. So now I'd love to introduce some pretty remarkable women. These are our safety action meeting coordinators from across the district. They're going to talk a bit more about risk assessment and also some of the strategies that are in place across New South Wales. If you don't know these women, take down their names, get to know them. They're people you're going to want to have some strong relationships with. So I'm going to hand over now to the SAMS coordinators.
Okay, so my name is Kath and I'm the Safety Action Meeting Coordinator for the Manning Great Lakes LCP, which is a division of the Mid Coast Women's Domestic Violence Court Advocacy Service. I'd like to begin by respectfully acknowledging the traditional custodians of the land that we meet on today and pay my respects to their elders past and present and extend that respect to Aboriginal and Torres Strait people, Islander people here today. So I've been invited to speak to you about the Safer Pathways program and the domestic and family violence risk assessment framework that is currently being practiced by New South Wales Police, local coordination points and local support services. Local support services are the organisations that provide supports to male victims of domestic and family violence, and the local coordination points that we sit with provide support to female victims. So I'll start by, this is a huge topic to try and get into a small time frame, so we've done our best to try and get as much information on the key points in, and we're happy to field any questions that come through later. So the Safer Pathway is a statewide program that assists victims of domestic and family violence to access timely and appropriate services to keep them safe, increase resilience and meet their needs. Safer Pathway sites were initially rolled out between 2014 and 2018, but recently these sites have changed to align with the police district boundaries. Mid-Coast, WDV CAS, covers 2 local coordination points. That is the Manning Great Lakes and Mid-North Coast local coordination points that covers those respective police districts, and Coffs Clarence WDV CAS covers that respective police district as well. The LCP primarily receives referrals from New South Wales Police Web Cops via the Central Referral Point, which is an electronic referral platform. So how that generally looks on a day-to-day basis is we go into work overnight, those referrals come through. So any domestic incident attended in those police districts, those referrals will come through to for the female victims, they'll come through to us. The LCPs receive referrals for victims, female victims 16 years and over, identified by police in their events. Referrals received for all incidents reported to police and attended by police that result in ADVO applications, where there's charges and where there's no offence detected or no further police action to be taken. So how that looks, that could include police attending and there's been a significant domestic violence incident and an AVO and charge is going to be laid on that perpetrator. We would support that woman through assessment and through the court process. But also, if police attend and it's a verbal argument, perhaps the neighbours have called, they've heard yelling and shouting and there's no offence detected, we will also have to contact that female victim as well. So police and the LCPs are both required to conduct the domestic violence safety assessment tool with victims. The use of this tool, which is more commonly referred to as the DV-SAT, is mandatory amongst New South Wales police responding to domestic violence incidents. And the LCPs must also re-administer that DV-SAT during engagement with the victim if it's appropriate. The purpose of the LCP re-administering that assessment is to produce a comprehensive risk assessment, including the level and type of threat to the victim and her children, to inform the prioritising of serious matters and to tailor service responses to her specific needs, focusing on risk mitigation. The DV-SAT is comprised of 2 sections. Part A is made up of 25 evidence-based questions identifying risk factors associated with serious assault or homicide in intimate partner violence. If a victim replies yes to 12 or more questions, that matter is then escalated from a threat rating to a serious threat risk rating. When a matter is considered serious threat, it is referred to a safety action meeting for consideration, and Nat will speak further to that as we move on. Part B captures the client's perceived level of fear, and we acknowledge that she's the expert in her own safety. After all, she is most familiar with the perpetrator's pattern of behaviour, and she has established strategies over time to keep herself safe and alive, because we're speaking to her, which is really important. How an assessor may identify the presence, however, we as the assessor may identify that there is a presence of greater risk, and we can use professional judgment to escalate that matter at our own discretion, as can police. Significant risk factors to consider when escalating the victim's risk to serious threat includes a history of extreme physical violence, such as strangulation and sexual assault, and also the perpetrator's access to firearms. And that comes up quite often being regional New South Wales. There's lots of properties with farming, where firearms are present because of farming and those type of needs. So that's quite noted in our offices. All right. However, we can escalate to serious threat using professional judgment, but it's the police domestic violence officer who is the only one, or police, that can downgrade a matter. It's not appropriate to downgrade a matter without consideration of the circumstances of the event and to ensure the client has access to services and supports. It's not uncommon for that threat level to fluctuate based on the victim's circumstances. The threat to their safety may be mitigated if the perpetrator is in custody at the time or unaware of her location. But on the other hand, that threat may escalate if the victim is geographically or socially isolated or is unwilling to engage with support services. We further acknowledge that the DV-SAT does not always produce an accurate or result in an accurate assessment of the risk if the victim is unable or unwilling to fully provide details of their experience. And that could be influenced by the presence of the perpetrator when we contact them, or their fear of repercussions from the perpetrator and or their family. Language and cultural barriers may impact that, and fear of police and other services that may influence what she is willing to tell us about what's going on. So in these cases, it's really important to have skilled assessors to conduct the assessment and recognise the risk factors and warning signs. And further, it's necessary that a service-wide response, including information sharing under Chapter 13A of the Crimes Act, is implemented to reduce further acts of violence and homicide in the context of DV. So before I hand over to Nat, I would just like to finish by saying that as a society, it's our responsibility to protect the most vulnerable, and that includes all people impacted by domestic and family violence. And the Safer Pathway continues to deliver timely, effective and consistent responses for victims of domestic and family violence across New South Wales. Nat, over to you.
Thanks, Kath. So I'll talk about the safety action meetings. So they're chaired by senior police. They're attended by Department of Communities and Justice, Health. So we have mental health, drug and alcohol, emergency and child and family. We have education attend, corrections, and of course women's domestic violence specialist services that attend. And at those meetings, one of the things I think that's really important to note is that what's come out of the SAM, or the introduction of the Safer Pathway, is the really exceptional collaborative response. Historically, we've worked in silos. You know, there's been lots of missing gaps of information. So we're working with a family, someone else is working with a family, or 3 other agencies are working with a family. No one actually knew who was doing what. Whereas the introduction of the Part 13A has enabled at the SAM meetings for this sharing of information that has a real influence on improving risk, reducing risk, improving safety for women and children predominantly. So one of the things that I've found really quite astonishing is since we've started the SAM, the partnerships and relationships that we've built with all of these services has gone to like this next level. So even though we get a referral in and they may be assessed as serious threat, immediately I can sort of start getting on the phone or emailing all the stakeholders who attend the SAM, and we start on reducing risk immediately. So it's a really timely response to that. And then hopefully by the time we get to the SAM, you know, lots of the risk is reduced and that they can be regraded to sort of at threat and the risk is mitigated. So that's sort of the outcome, and something that we've never really had before prior, I think, to the commencement of Safer Pathways, this real building of relationships and this trust that we can share valuable, relevant information that works to really support safety for families, especially for women and children. And one of the things that I think it also supports is we talk about police response. Police go out to incidences, police respond to domestic violence no offences. Now that we have these really quite solid relationships, we have a lot of external referrals from services where perhaps the woman is too frightened to go to police. Perhaps there's historical reasons why she doesn't want to go to police. So she may not want police involvement. However, through the links and the key relationships that we've established within the Safety Action Meeting forum, we have other services refer in and say, there's issues going on with this family, with this woman, she's really fearful but she doesn't want police involvement. So I know one of the things when Safer Pathway first came out, it was like, what about the women? There's a big gap there for women who don't actually go to police. Well, now I think with all these key relationships and partnerships, that gap's closing, which is like, to me, that's a real benefit to having the relationships that are established and a forum where information can be shared and be confidently shared, where there's, you know, confidentiality is the key, and it is around the wellbeing and safety of women and children predominantly. And another thing that there's a real focus of the SAM is that, you know, and DCJ spoke to this prior to us, is around there's always been this onus on the woman. You know, women, what's she doing? How's she putting in protective measures? What's she done to keep her and the children safe? Whereas now, because we have this space where we share information and we have a focus on the whole of family approach, we make the offender really visible in that space. How can we actually hold him to account? What can be done to make sure that there is eyes on him? So let's take the onus off her and the responsibility off her, which has always historically been the number one focus, and let's actually put the focus on him. Perhaps Department of Communities and Justice can refer him to, you know, mental health, drug and alcohol, men's behaviour change programs. Police can do additional AVO and bail compliance checks. Corrections can increase supervision. Let's really hold him visible in that space so that we're not putting expectations on her all the time, because historically that's what we've done. Let's shift that. And I heard from DCJ's presentation that that's a shift that they're working towards as well. So that's a really important aspect, I feel, for the SAM, and it provides a space where that can be done in a respectful way. So it's a holistic response. It's not, let's put the onus on her or let's just keep demonising him, because it's not about that. It's about this holistic, really family response that holds him to account. As a community, we're responding to domestic violence. It's not the expectations on her. Like, what can we do as services to increase her safety? Let's think about it from a different perspective. So that's the focus of the safety action meeting. And I think a real key positive is the collaborative practice that occurs, this collective response and shared vision to reduce risk and increase safety and wellbeing for victims and children of domestic violence. So I'll hand over to you, Rach.
Okay, thanks, Nat. Okay, so my name's Rachel. I'm the SAM coordinator for the Mid-North Coast Local Coordination Point, and I'll be talking to you about the key things when referring clients to the SAM. And some of these things might recap sort of what Kath has spoken about as well. So you might have a client that you're really concerned about, that may be at immediate serious threat of domestic and family violence, of serious injury or death. So what do you do from there? How do you escalate the matter to the SAM? Well, there's three main things to remember. So the first thing, please don't hesitate to contact the SAM coordinator for advice if needed. For myself, if it's hard to catch me, email is always the best, and then I can call. For the second thing, sending the SAM referral form through. You'll probably get the referral forms for the SAM and the DVSAT form sent after the forum. So I guess what are we mainly looking for in the referral? So A, whether the client has consented to the SAM referral. So if the client refuses consent, you can still send the referral through to the SAM coordinator anyway. B, we're looking for whether the risk is immediate. So the client might disclose serious incidents that have happened historically, but is the client a serious threat right here and right now? And C, what benefit can the SAM offer to reduce the threat? So the purpose of the SAM isn't for case managing clients, it's for reducing and mitigating the risk for immediate serious threat matters. So the third thing is when sending the DVSAT risk assessment tool, send it to us via email where possible. And for the DVSAT, as Kath said, there's 25 questions. And as a general rule, for scores 12 and over, the client is deemed at serious threat. But your professional judgment can override this. So the client might score under 12, but your professional judgment is that they are at serious threat, maybe because the woman is minimising the violence or they're too scared to disclose the violence. On the other hand, the client might score over 12, but most of the information that they've shared is historical. So there's no immediate risk, so your professional judgment is that they're not at serious threat, and then you don't send the SAM referral through to us. So for the DVSAT, it's important that we need as much information in the comments section as possible. So we need to know if the information that she discloses relates to the current risk or whether it's historical. So for example, if the client says the perpetrator has threatened suicide, ask the client open questions to get as much detail as possible. For example, can you tell me more about that? When did it happen? How many times? Just try and get as much information so it helps us assess the risk appropriately. So, and then I guess how do you know what the outcome of the SAM referral is after you've sent it to us? So we assess the referral and we let you know if it meets the SAM criteria, and if so, it's placed on the SAM agenda. And if not, then it's not placed on the SAM agenda, and we'll let you know why. However, if you do get new information and the risk increases, then you can re-refer the matter to the SAM and send another referral through. So how do you know the outcome of the SAM itself? So your SAM rep for your service will speak to your referral at the SAM, and we go around the table and the agencies provide all their information, and then we go around the table again and the agencies offer their SAM actions, and a safety action plan is put in place. And that at the SAM 2 weeks later, those actions should be completed and then the matter is closed at the SAM. There are times where more time is needed to complete the actions, or there are new actions developed, but usually the matter is closed then. So the matter that you've referred might also be regraded down prior to the SAM as well. So regrades are still listed on the agenda with the reasons why they're regraded down. And then if SAM members don't raise any concerns with the regrades, they're closed at the SAM. So if the matter is closed, it doesn't mean that we're still not concerned about the client. If the risk does increase again, for example, if the perpetrator is released from jail and is harassing her again, then you can re-refer the matter to the SAM, try and get her to go make a statement to the police so it can come through as a police referral, or we can get it through as an external referral from your service. So in closing, we hope that this session has helped to strengthen the links between you and the SAM. We all have a shared passion to help women and children live free from violence. And as you know, it's about us working together like this forum today and supporting each other and getting the best possible outcomes that we can for the client. So don't forget, if you need advice or assistance, please call us and just send the SAM referral and the DVSAT form through to us. Thank you for listening and all the best for the rest of the day. Thanks.
Thank you very much, and apologies for my cameo halfway through. We're living half in a virtual world and a live world, so thank you so much for your session though, and remember their names. Okay, so that concludes the risk assessment session. We're moving now on to response. So we're going to start this part of the agenda with, I guess we're very privileged to have Dr. Kathy Kramer offering us some information about the importance of medical reviews for victims of domestic and family violence. Dr. Kathy Kramer is the Medical Governance Director of Sexual Assault Services and Child Protection. So we'll get that stream up for you now.
Hi, my name is Dr. Kathy Kramer. I want to thank the organisers for inviting me to talk today, and thanks also to all of you, wherever you are, for attending. I had a birthday recently and I bought the t-shirt you can see in this slide. I bought it to wear to my child wellbeing clinic at Kempsey Hospital. This is a clinic where I see child victims of sexual abuse, so they can have a checkup and know they're okay. This clinic is part of my work at the Mid-North Coast Local Health District, where I'm a specialist in forensic medicine. Most people know about forensic pathology. They're the guys who do autopsies, so their patients are dead. My patients survived whatever crime was committed against them. So they need not only the same thoughtful collection of evidence that may help the police and the courts, evidence such as DNA and photographs of injuries, but also competent medical care that not only attends to any physical injuries, also helps them feel like a whole person again by treating them with respect following an event that may have stripped them of personal dignity. In this slide, you can see one of our sexual assault nurse examiners. She's wearing a DNA-free gown and preparing to do a forensic medical examination. Today, I'm going to be talking about some aspects of the recognise step in the 5 Rs. In particular, I'm going to talk about 2 common elements of domestic and family violence that you may encounter and which may need a medical response. They are strangulation and traumatic brain injury. Neither of these are subjects that are easy to listen to, but I hope you'll bear with me. One day, this information may be vital for someone you know, whether it's a client, a work colleague, a friend or a family member. Let's start with strangulation, which was something that was never even mentioned when I was a medical student. In my experience, women find strangulation very hard to talk about. When I asked survivors what was going through their head at the time, every one of my patients has told me they thought they were going to die. But more than that, To have someone you thought you loved, who you thought loved you, throttle you while they watched the fear and the pain in your eyes. It's an agony I can only begin to imagine. So if someone tells you they've been strangled, I want you to take a moment to thank them for their bravery and for putting their trust in you. And because it's so difficult to talk about, if you work in a field where you routinely work with survivors, I urge you to be the one to ask clients if this has ever happened to them. If you're watching this webinar but you work in some other field, you may still be the one to suspect strangulation. Perhaps someone has marks on their neck or is covering their neck for no good reason. Don't just wonder, ask. And by asking, you may just save a life. Women whose violent partners strangle them are 8 times more likely to go on to be killed. 8 times. So be the one to ask and be the one to validate the concerns they probably already have about their own safety. The neck is full of vital but sensitive organs that can be damaged during strangulation. In this slide, where the skin has been removed, you can see just how close they are to the surface. To take just one example, there are arteries there that carry oxygen to the brain. If these are damaged when they are compressed, the person can have a stroke. And that stroke may take place days, weeks, or even months later. If someone's been strangled in the last 48 hours, they should have an urgent medical assessment. Just because they seem fine now does not mean they're not going to go on to develop serious airway swelling in the next few hours. If the most recent episode was more than a couple of days ago, this is less urgent, but a proper medical assessment by a GP is still important. The other issue that has quite rightly gotten a lot of attention recently is traumatic brain injury. Victims may have been strangled to the point of unconsciousness repeatedly. There may have been blows to the head from fists or being thrown against walls or furniture, not once, but many, many times. When DV services in Nebraska were trained to ask about a history of head injury or strangulation, about 2/3 of women screened positive. When a UK emergency department started asking women who presented with concussion symptoms about DV, it turns out about 2/3 of them sustained their head or facial injuries as a result of domestic violence. And you can see some Australian data in this slide. A major brain injury is, of course, going to put that person in hospital, but symptoms of mild traumatic brain injury, such as dizziness, headache, irritability, insomnia, memory problems, they may go unnoticed, or the perpetrator may restrict the victim's access to care. These symptoms may last only hours or days after the blow, but can last weeks, months, or even longer. And worse, even relatively minor blows to the head can cause lasting damage if the brain was still recovering from a previous blow. We see the effects of repeated trauma in sport such as footy, but because sporting accidents are visible, everybody sees what happens on the field, coaches can swing into action, they can check the player over, take them off the field. No one's going to do that for victims of domestic violence. So if you know or strongly suspect there's been violence to the head, ask. If you are seeing possible symptoms of traumatic brain injury, explain your concerns and ask the big question. This person may need medical help. The damage can't be undone, but we can find ways to help people mitigate the symptoms, and medical documentation may be invaluable in court. But more than that, understanding that what they're experiencing is a result of brain trauma and not, say, because they're going crazy, as a perpetrator will often have told them they are, can be a huge relief. American research shows that although women had varied reactions when they learned they might have a brain injury resulting from the trauma of their domestic violence, they were nevertheless thankful that now they had an explanation for some of the cognitive symptoms they were experiencing. So, what would a medical response look like if the woman were to come to a doctor like me? Forensic medical examination is pretty much what it says on the tin. It has 2 elements, medical care and forensic care. For the forensic side of things, we're talking about documenting injuries in a robust way that's going to withstand close scrutiny in court. For example, there may be scratches on the neck where the victim tried to pry the assailant's hands off. If the perpetrator was an ex-partner, we may swab under the woman's nails for his DNA. We may take high-quality photos. We may collect torn clothes. For the medical side, we're performing a thorough assessment for injuries that may require urgent treatment or follow-up care. But at each step of the path, the woman is given the choice. Perhaps they're happy for a written description of an injury, but not with being photographed. Their wishes are always respected. And of course, doctors like me work in a team with experienced counsellors who provide essential support for the woman and help with safety planning. For most local health districts in New South Wales, mine included, a formal medical and forensic response is currently being offered only to people who have experienced recent sexual assault. However, most of these cases occur within a domestic and family violence context. And having said that, we work very closely with emergency department staff to educate them to ask the right questions so the patient gets the right care, and to make careful notes should they be needed in court. Does every victim of domestic and family violence get the medical and forensic care they deserve? Not yet. But we have come a very long way, and I remain optimistic for the future. Thank you.
Thank you very much to Dr. Kathy. It's now my pleasure to introduce Daniel Dunn-Bowen from New South Wales Police to talk a little bit more about the police response to domestic and family violence.
Ready? Good morning, everybody. Thanks so much for having us on here today. It's our pleasure to come and talk about police response to domestic and family violence. We are going to go through quite a lot today, so if there are any questions, obviously feel free to contact us after the session, but we will try and get through as much as we can in our 10 minutes that we've got to do today. So yeah, thanks all for listening. Just want to acknowledge the traditional owners of the land that we're meeting on today and recognise the continuing connection to the land and waters, and of course pay our respects to elders past, present and emerging.
The New South Wales Police is committed to the protection of all victims of domestic and violence offences. All New South Wales police officers are trained in dealing with domestic and family violence matters.
So police must investigate all domestic violence incidences. So police will separate all parties, speak to all persons involved, speak to any witnesses, examine the crime scene for any evidence, take witness statements, written or by way of DVEC, and gather evidence, which could be photos.
Okay, after investigating an alleged DV incident, police will do one or more of the following. Make a report only, including notifications to support agencies, make application for an apprehended domestic violence order, or arrest and charge the offender.
So important to know that the victim's consent is not needed. The law requires police to take action if a domestic violence offence is detected. The victim's consent is not needed for police to apply for an AVO, arrest an offender or charge an offender. So if police suspect that a DV offence has occurred, they must take out an ADVO and take appropriate action, whether it be charging or not. At a minimum, the matter must always be investigated.
Domestic violence evidence in chief allows police to take a video or audio recorded statement from a domestic violence victim in relation to a domestic violence offence and use it as all or part of their evidence in chief or main evidence at court. This is submitted instead of a written statement. Informed consent is required for a DVEC to be taken. The complainant must be 16 years of age or older and cannot be used in AVO only matters.
So if a victim is suitable for DVEC, obviously what is considered is their demeanour and state of mind at the time. So DVEC provides many advantages for victims, including it reduces the trauma for complainants when they tell their story in front of offenders. It reduces or eliminates the intimidation of the complainant to change their evidence. It reduces difficulty in remembering details of the incidents at a later court date, as the recording will be played before any additional oral evidence is given by the victim. Brings the demeanour and the experience of the complainant into the courtroom, increases the ability of complainants to give an accurate account of what happened at the time of the incident and referable to the scene of the offence, and it's time-saving for police and complainants. There's no need for a written statement, and increased pleas of guilty and increased conviction rates. So the presence of the DVEC itself raises the probability of conviction at a defended hearing by about 24%.
Okay, ADVOs, or Apprehended Domestic Violence Order, are orders made by the court or police to protect a person from violence, threats and harassment from a spouse, de facto partner, ex-partner, family member, carer or person living in the same household or have a kinship relationship with, or an ex-partner or current partner, even if they don't know each other.
You're up again.
Plain English AVOs. So what this offers, so we've got simple language. The previous AVOs, or apprehended violence orders, were too hard to understand. The new plain English AVOs are easy for everyone to understand. Personalisation places the responsibility for compliance on offenders. The prioritisation of key messages. DVOs will list at the beginning of what will happen to the offender if they breach any of the conditions. There will be examples and it's explained to the offender. Strong messages such as what exposure to violence does to children and information on where you can talk to someone about managing emotions and stresses will be provided.
So there are also such things as national DVOs. So in 2017, amendments to the Crime, Domestic and Personal Violence Act came into force, which allowed New South Wales Police to enforce domestic violence orders that were made on or after the enactment date in other Australian states or territories. So other states and territories are also able to enforce New South Wales ADVOs. These changes are known under the National Domestic Violence Order Recognition Scheme, or referred to as the scheme. So what this means is police will treat a reported breach of an interstate ADVO that has occurred in New South Wales just like it was reported as breach of one of our own orders. However, unlike one of our own orders, police will have to contact the state or territory that issued the order to obtain a copy before they can charge the offender.
Okay, children and domestic violence. At a domestic and family violence incident where children are present, police officers or officers will use their professional judgment to make an assessment or determine whether the child or young person is at significant risk of harm. If there are only children listed in the AVO application, police are the only authority who can make the application. It's encouraged to include these children in AVOs where children are involved in domestic and family violence incidents.
So if a defendant breaches an AVO protecting a child, the police will consider whether this breach places the child at risk of significant harm, in which case they will be required to make a report to the Child Protection Hotline. A breach of an AVO is a criminal offence and as such may place the child at greater risk of harm if the defendant has no respect for court orders or the safety and well-being of the victim or the children.
Okay, so targeting offenders, domestic violence high-risk offender teams. So we've got two teams in the North region. They aim to reduce the rate of reoffending and provide increased safety to victims. They proactively target high-risk DV offenders across the region and conduct investigations into identified high-risk offenders.
So these teams have a sergeant, usually 4 or more constables and an intel analyst attached, and as Dan said, we've got 2 of these in the Northern region.
Our DV STMP, or Suspect Target Management Plans, I think we're up to number 3 now, but the process is proactive and coordinated approach to assessment, targeting and management of high-risk repeat DV offenders by police at command district levels. We aim to reduce reoffending, providing increased safety to victims, and there's many strategies designed for each targeted offender.
So the Men's Telephone Counselling Referral Service. So the DV Male Offender Referral Card, these cards are provided to male offenders by police during the ADVO compliance checks. They're designed to encourage the recipients of the cards to seek help. The automatic referral to the Men's Telephone Counselling Referral Service, this started to happen from December 2018. So all adult males aged 16 and over who are defendants named in police ADVO applications or have been charged with a DV criminal offence are automatically referred to the Men's Telephone Counselling Referral Service. So the obligation for police, they don't need the consent of the offender, but they must advise the offender that they will be contacted by the service. Unfortunately, there is no formal referral pathway at the moment for female offenders, but the Men's Telephone Counselling Referral Service, it's a Victorian service. They've worked with male offenders for many years. They are specifically trained in ATSI specific practice, and they're tertiary qualified counsellors. So that occurs behind the scenes.
Okay, role of the domestic violence officer. So there's many role descriptions, but these are the basic ones. So facilitate...
This is the old DVLO. We've dropped the L, just so that's what it's DVO
officer,
now.
DVO. Facilitate the court process, including consulting with the prosecutor and providing information, referral and support to victims. There's liaison between police and victims and DV support services. Preparation and attendance at safety action meetings, or SAMs. Quality review of all DV events. They also keep police informed of the latest legislative changes and domestic and family violence research, and assist with implementing changes within the command. And that's really important so that the frontline police stay on top of what is legislative requirements. They also monitor trends, so we'll see spikes and things that are happening in different areas and localities, and they assist with that.
So the Region Domestic Violence Coordinator, so that's my role here in the Northern Region. So I cover from Tweed Heads border, so the 5 police districts along the coast, to the other side of Taree, Bulahdelah is the end of the Manning Great Lakes Police District. So I won't read out all the things, but in essence it's an integrated, coordinated response by the government to domestic and family violence. So my role has some of those key points, but basically it's maintaining effective partnerships between police and the external agencies, contributing to projects within the region about the coordinated approach to domestic and family violence, representing the New South Wales Police Force at any internal meetings, could be DPC. I'm a member of all the DV committees, or try to get to them all, as many as I can throughout the region, as well as you'll see me at the SAM meetings from time to time, and trying to be just that contact point for the region, along with trying to participate in DV events. I do a bit of frontline training with New South Wales Police. And at the moment, I think most of you have heard of me in relation to annoying you about the Love Bites program. So I'm the project lead at the moment in relation to trying to get Love Bites back into all the schools by the end of 2022. So yeah, it's quite a varied role, but really an important one, I think, to link police with what's happening in the community and to get community engagement and support for certain things, as well as being a sounding board for you guys. So always happy if you've got any questions in the DV space, or there's issues or something police can help with, I'm that person you can reach out to, and I'll at least connect you with the right person. Or if you just want myself and Dan to come out and present on different topics or issues within the DV space, that's something we're able to do as well.
I think the bottom one there is the key message. She's a subject matter expert on all things contemporary domestic and family violence plans and policies. So
it's a lot to know.
A great resource. What do I do? What don't I do? Facilitate community engagements, including domestic and family violence events and multicultural events. So we deal with the call community as well. Educate the business community on crime prevention strategies, looking at ways that we can to make things safer and reduce that fear of crime in the community. I deliver crime reporting presentations to schools, both primary schools and high schools, the elderly and the business community. Assist in the facilitation of youth programs. So we've got some fantastic youth programs running, especially up in the Coffs Clarence Police District at the moment. Our YARP program, our Youth Active Rewards program, has been a massive success for us, and we've seen the reduction of youth crime in the area. Conducting community safety audits and business security audits. So they happen at our reserves and parks, and also in relation to online business, as well as physical businesses in the community. Assist the police district with social media, including cyber safety presentations. So we look at our Facebook page, our Coffs Clarence Police District Facebook page, which I think has now close to 15,000 followers. So a very good collective audience to have if we want to identify someone. And also awareness and education sessions, exactly like what we're doing today. And just the last slide here, as you can see, there's a number of different numbers that we look at for crime reporting, especially in relation to domestic and family violence. One of the things I would reiterate is that if there's an emergency or something that's requiring a prompt response from police, ring 000. Do not hesitate. The emergency services is there for that particular reason. If there's something that you want to talk to a police officer about, ring your local station. I know Coffs Station's number is 66910799, or the Kempsey local station here. 1800 RESPECT or 1800 737 732 is a contact number for domestic and family violence. 24 hours counselling and all those key points that you may need in relation to domestic and family violence
And
information.
that's a good starting point if you don't know where to go. The 1-800 Respect people are amazing, and they'll connect you to the right place if you're not sure where to start.
There's also Crime Stoppers, 1800 333 000. Suspicious activity, anything that you want, information you may have in your neighbourhood that you want to get to online reporting. And also there's the community portal at newsouthwalespolice.gov.au.
Yeah. And Crime Stoppers can be anonymous for those who just want to give a bit of information but not put their name to it. That is an option that is available to you. But for New South Wales Police, as you see, there's a couple of the campaigns. There's too many for us to display all of the current ones at the moment, but no innocent bystanders as per this one here. It's a really big thing. You know, domestic violence is, we don't want it to be something that's behind closed doors. We want people to speak up. And speak up for those who can't or don't. So please do use the Crime Stoppers line, report what you know, because as you say all the time, we
can't fix it. If we don't know about it, we can't fix it. So we try to get that message in the community. Speak up.
Cool. And I apologise, it was quite content heavy, but there was a lot of things that we wanted to cover. But as I said at the start, if there's anything else that you want to reach out to us about after the forum, I'm sure our email addresses and stuff will be available online. If you've got any questions, happy for you to contact us. And thank you for having us.
Thank you.
Quick winner. Thanks.
Thank you so much. Thank you very much. We're just going to play a couple of little slides while we change microphones around. That concludes, I guess, the response section. Once we've got our next guests all ready to roll, we'll get started on the referral section of the agenda. Okay, welcome back, and I'm just so pleased to introduce the coordinators of our Women and Children's Refuge, refuges across the district. I think domestic and family violence, the first point of call people often think about is the crisis accommodation provided in the safe houses across our communities. So I'm going to hand over now to a fabulous bunch of professional women to introduce themselves and to talk more about the life of working in a women's and children's refuge.
Thanks, Taryn. My name's Michelle Stocks. I'm the Community Services Manager for Samaritans, and I look after the Taree Women and Children's Refuge as well as the Kempsey Women's Refuge.
I'm Jenna Bambralay. I'm the Specialist Domestic Violence Manager at Liberty Domestic and Family Violence Specialist Services. I oversee our specialist homelessness services as well as our IDFVS program community partnerships.
Hi everyone, my name is Prue Young. I work for Warina Women and Children's Domestic Family Violence Specialist Services, and I am the SHS Coordinator at the Women and Children's Refuge.
So DV is everybody's business, and what a wonderful opportunity today is for all of us to talk about sharing that responsibility. And what often occurs is the first point of contact for service providers is to reach out to an SHS DV specialist service. We will talk to you briefly about what's a good referral, what's a realistic referral, and what we can manage and work collaboratively all together on. I can say just in the first 12 weeks of our first financial year, we have already met our targeted numbers.
Agree. So has Liberty?
Yep, we agree. We hit capacity quite early, so
yeah,
I think it's across the board the same.
Yeah. So the sheer number of referrals that we are receiving reflects the numbers of increasing disclosures of DV as the stigma decreases and the awareness grows.
It's important for service providers to understand that whilst there may be DV or domestic and family violence that's mentioned with that client, they're trusting you to reach out, not to pass on to a service that you think is going to be the be-all and end-all. There could be a range of issues. Take the time, use that window of opportunity to explore what are the main presenting issues for that woman and her children at that very moment, and whether it be safety or a long-term sustainable housing plan as SHS providers, we can do that. But trust in your client that's talking to you.
Many women will want to stay in the relationship, and it's really important that they feel supported in that decision and assisted to create safety plans and decide what is safest for her. Unfortunately, when women do leave, they're at the highest level of risk of homicide. So we have to take that into account to not project our thoughts of what she should do in her relationship. In terms of case management happening from other service providers, all of us are more than happy to support you in your case management of the client. We can provide guidance, we can provide support, we can provide advice. What we do know is that often when women have trusted you with their story and then you refer and it's not a warm referral, they have to restart again, retell their story, they're at a higher level of disengagement from services altogether. They've dipped their toe in the water and then they've been kind of left to sit between services. They're at a higher level of disengagement at that point, which we know increases risk to women and children.
It's also quite common for services to respond, as Jenna mentioned, with their own personal reaction. Remove the victim, get her safe, get her out. Actually, that puts her more at risk. So in the Mid-North Coast, there is a lack of affordable housing. There is less than 1% vacancy rate in the Mid-North Coast for social housing as well as private rentals. And it is not the victim and her children that should be removed from her home. We can do that if necessary, but at all opportunity it's about holding the perpetrator accountable, working with the victim, and that familiarity of not having to be uprooted and then put into a refuge, which we'll talk a little bit about, because there is often an unknown about what it does mean to live in communal living in a refuge.
Yeah. Brings us to a good point, doesn't it?
Yeah.
So I think what is really overlooked within refuge environments is that it is a communal living setting. So people are sharing a home. They have their own bedrooms, but all other facilities are shared. So what I often like to say to service providers is if you wouldn't be comfortable to live in the same home as a client because of complex needs, please don't refer them and set their expectation that the refuge is going to be their option. It makes it unmanageable for us, and we really need to be trauma informed when we're looking at the dynamics and looking who to place together, because when it goes wrong, it goes very wrong, and we are working 24/7, we're being called in, things can go really pear-shaped. If people are evicted from a refuge for what would be considered a behavioural concern, they actually aren't able to access temporary accommodation, which really limits their options. So realistically, it's better that they go into temporary accommodation and are supported to remain in place there, because they're less likely to have that eviction process from a refuge, which none of us like to see happen.
No, it's awful. And I would just add that, you know, we want to set them up for the success. This is about the client, and if we're bringing them into a home they're all sharing and it's not going to work, then there's other avenues for us to support that client.
Yeah, absolutely.
It is also, again, important to remember that refuges aren't under the old model of 24/7 monitored and staffed. We are there Monday to Friday during business hours. So the assumption that a client might have a prevalent mental health condition and there is DV, so we'll put them in the refuge, that's not the right choice. We need to consider what that person's major presenting issue is at that time, and whether that be mental health, whether that be drug and alcohol, possibly both. If there's child protection issues, please don't assume that we're there keeping an eye on things, because we physically aren't, and you are potentially putting that family at risk as well as other residents. So that's where we come back to. DV is everybody's business. Everyone has a role to play. Crisis services can do so much, and we will do whatever we can, but we will do it with collaboration and support from other service providers.
Absolutely. Yeah. I think when we come from a child safe perspective, remembering that there's children who have experienced incredible trauma, who are trying to recover from that trauma, and they really need a safe space to do that. So it's up to us to make those refuges a bit of a sanctuary for people to recover from that trauma.
Yeah. I think I was just going to add that it is difficult when there's unmanaged mental health coming in. I know that you did touch on that, but just that this is, you know, it is a place to recover. It's for children, and that can't happen when there's tension and the dynamics aren't right in the house. So even if we do have a vacancy, that might not mean that it's going to go to the first referral that comes through our email, that we have to try and work out how their house is going to be.
Yep.
And that's usually a team discussion or... Yeah.
And just like Housing New South Wales and our community housing providers, our wait lists aren't first in best dress. We're constantly assessing, we're constantly triaging the situation, the other supports in place, the risk of homicide, as well as the complexities that the client is facing within themselves. So we have to constantly be looking at the referrals coming in to navigate that wait list for accommodation.
That wait list is a common denominator across all three services, which highlights that, yes, the stigma of domestic and family violence is lifting, and people are reporting and seeking help, but it's important to share that load, because if we don't share the load, that's when we will have someone fall through the gaps, and falling through the gaps could be, as Jen said, is a homicide, and we don't want that. Our refuges are set up for our women and children especially. We need to continue to highlight that there is always going to be 99.9% of the time children in the refuge, and they are going through the most traumatic period in such a little mind and at a very precious time in their life. So be cautious and reach out to us. We aren't going to say no, but we're going to support you and help you and navigate that journey alongside you with that client who's trusted you in that first instance to reach out for some help.
Yeah.
Yeah.
Do we have anything to add?
Thank you very much for the information, I guess a little bit of insight onto what it is like in a women's and children's refuge. I hope that, I guess, that you know these women and you have their contact details and you're in conversation with them. They'll be behind you supporting your clients and families.
And we're all online. If you have questions, send them on through.
Yes. Right now?
Yes.
Right now, so if you have any questions right now, we're going to go back into the chat room and start answering any questions that you do have. I guess this is also a time to take to acknowledge that it's these wonderful women who have come together to develop these resources and to have this forum. And so really value the collaboration that we've had to get this off the ground. And thank you very much for the time and effort that we've all put in.
Yeah, thank you too,
Thank
Taryn.
you.
Yeah.
Now at the back in the chat room.
All right, off we go.
The work is never done. Okay, now I'm so pleased again to introduce Kelly French from the Mid-North Coast Community Legal Service, who's going to talk a bit more about law and domestic violence. This is personally a service that I hold in really high regard. This is a service that gives a voice to those who feel they don't have a voice and don't have a place in community. So it's my great pleasure to introduce Kelly and to, I guess, introduce the rest of the people online to the wonderful work that they do. Thank you so much.
Hello everyone, I'm Kelly. I'd just firstly like to acknowledge the traditional custodians of the land and note that we're all meeting on different lands this morning. I'd like to pay my respects to elders past, present and emerging, and of course respects to any elders that are with us today. So my name's Kelly French. I'm with Mid-North Coast Community Legal Centre. I'm one of the solicitors that work from the Coffs Harbour office. And I really appreciate everyone that's watching today so that we can share our service with you and what we do. I'm one of 3 solicitors that work from our Coffs Harbour office along with our administration and client service assistant. And there are further 7 solicitors working from our Port Macquarie office together with our administration staff and an Aboriginal engagement officer. A little bit about our service. We're a not-for-profit legal service that provides free advice to clients between Taree and Coffs Harbour, and that includes places like Kempsey and all the way out to Dorrigo. As I said, we're a free service and we provide both telephone and face-to-face advice. We complete limited casework for disadvantaged clients, and we also conduct outreach clinics in a variety of locations, which are all getting back on their feet now post-COVID. Well, we started Kempsey back up, and we've also started Coffs Harbour Neighbourhood Centre. So we are in Coffs Harbour Neighbourhood Centre on a Monday morning. We operate initially by taking clients' details over the telephone, or they can come into our one of our 2 offices in Coffs Harbour or Port Macquarie. All they do is outline a reason they're seeking advice, and a solicitor will generally call the client back within 5 business days of the initial contact and provide that relevant advice. We also like to accommodate the cold community and offer telephone interpreting services and face-to-face contact with those clients so that we're best looking after their needs. We are a no wrong door service, which means that if we cannot assist a client with their matter, we will refer the client to the most relevant service. This will often be a warm referral, where we will assist the client to contact the relevant service, or we contact that service and have them directly contact our client. We know that often when a vulnerable person is reaching out for assistance, they may only make 1 call or 1 contact. So assisting with that next contact is extremely important so that our clients obtain the best advice and the most appropriate service. We work closely with Legal Aid in Coffs Harbour and Port Macquarie, and we're often referring clients to each other because it might be a more appropriate service. For example, we don't provide criminal or family law advice, where that is where Legal Aid can definitely assist. Although we provide a range of advice on civil law matters, what I wanted to talk today about is more the services that we can provide that directly relate to clients' experience domestic violence. This being advice around debt and advice relating to victim service applications. Debt can often arise within a domestic violence relationship. Victims of domestic violence might be pressured to obtain loans in their names, credit cards, or even expensive phone contracts. This can leave the person suffering from domestic violence vulnerable to remaining in that relationship, particularly if there's financial control or the victim is unable to make repayments without the partner's assistance. We can offer advice and options around this type of debt, which we often refer to as sexually transmitted debt. We've assisted clients previously with liaising directly with creditors to have that debt waived or reduced, and can also assist with financial hardship variations for those who are paying large loans or credit card debts as a result of their relationship. Often debts can be reduced or interest waived and payment plans negotiated. This depends on the personal circumstances of the client and what debts they have, and consideration can always be made to applying to be on the National Hardship Register. One of our big emphases with clients is particularly those experiencing domestic violence. If they have debts, not to ignore them and not to ignore any notices they might receive from creditors or letters of demands for payment. Clients should seek legal advice and or financial advice about how to best deal with those notices. We work closely with a number of financial counsellors in the local area and often refer clients to ensure that they receive full advice and best advice to secure a financial future and moving forward. Sometimes when leaving a domestic violence relationship, finances are crucial and might be a reason or barrier to leaving that relationship. So to be armed with some advice before taking that step or making that decision can be really helpful. And then the second topic I'd like to talk about today is victim service applications. Many of you might be aware of victim services, New South Wales Victim Services. They are state-based, but you may not know what they actually can do when it comes to a victim of domestic violence. So I'm just going to provide a little bit of an overview and then move on to what we do to assist with those applications. So New South Wales Victim Services provides a range of supports to victims of crime and also victims of domestic violence. Victim Services assist clients to access supports, including counselling, financial assistance for immediate needs, financial assistance for economic loss and for recognition payments. The process is designed for a client to self-represent. However, our service is very happy to advise clients on how to complete the application process themselves, or we will often act on behalf of a client to make an application, particularly when it relates to an immediate needs. In times of crisis, domestic violence victims can be difficult for clients to process or concentrate on completing paperwork or documents. And we've found that assistance with these applications is very well received by victims of domestic violence. It can often also be quite confronting. Primary victims of domestic violence can access up to 22 hours of free counselling. They're also able to apply for immediate needs assistance to assist in relocating to a safer place, implementing safety measures in their own homes, such as changing locks or installing security cameras, access to emergency medical or dental care, and also funds for the purchase of things like clothing, white goods, replacing microwaves or toasters or general household items. Sometimes it'll be just things like towels or even linen. Sometimes a victim will flee a relationship with only what they can either carry or put in a car. They sometimes need to replace general household items, school uniforms, bed linen. The package can include combinations of these funds to a maximum of $5,000. So it's capped at $5,000, but that can be made up of a whole lot of different categories of items, such as rent assistance, removalist costs, and then also funds for replacing white goods. This amount can go a long way to assist a client to move or make their home feel safer. I'll use a bit of an example. I'll use Mary. Obviously not her real name. She was referred to our service from a women's refuge in the local area. Mary had been seriously assaulted by her partner and had injuries to her teeth and jaw. Police were involved and charged the perpetrator on the back of a neighbour calling for assistance. And Mary planned to relocate to a safer location. We assisted Mary with counselling and an immediate needs application. The application, within the application, we requested particular assistance for Mary for rental assistance and removalist costs, because those are what she really needed. Mary's application was approved by Victim Services, and she received a payment into her bank account within 10 days from making the application. So this was a really important amount of money to be able to assist Mary to leave quite quickly to a place where the perpetrator didn't know she was moving. We continue to assist Mary with her application for financial assistance, to cover the cost of her ongoing dental and medical expenses, and this panned over about 6 months. It allowed her to have the necessary treatment she needed, and also from a doctor of her choice, a dentist of her choice, which was important to her. An application at that time for recognition payment was also made. So there are a number of applications that can be processed. As I said before, you can make an application for counselling and immediate needs and for recognition at the same time. Applications for immediate needs must be made within 2 years from the act of violence. Applications are generally processed in 2 weeks, and a successful applicant will receive the approved sum directly into their nominated bank account, but the bank account must be in their own name. Evidence of the act of violence is required by way of a police report, or you can get a report from another government agency or a government-funded agency, such as a women's refuge. Victim services will access the police reports on the applicant's behalf, so they don't have to do that. They're often asked, though, to provide an event number, which can be obtained from the police that the matter was reported to. On from this is if further assistance, financial assistance is required, this can be made through an application for loss of earnings. This is capped at $20,000. This might be because due to injury, the victim can't go to work, or they've had to relocate and try and get a new job. There's also covered under that is medical and dental expenses up to a cap of $30,000. So it's quite a substantial amount. And if victims aren't aware of this, they may not seek treatment, and their injuries can be longer lasting than necessary. The applicant may be required to provide invoices or receipts to substantiate their claim. Using Mary's example again, Mary obtained quotes from her dentist for a number of procedures to take place, and this was pre-approved by Victim Services, and then upon treatment being obtained, the dentist issued an invoice, and this was paid by Victim Services directly. An application for recognition can also be made in addition to an immediate needs application. These payments are not to compensate a victim of violence, but more to acknowledge that a violent offence has been committed against the victim. There are various time limits and levels of payment that apply to these applications based on the type and the seriousness of the offence or act of violence. For example, a victim who is assaulted during a domestic relationship receives an injury that amounts to a serious bodily harm. They will have 10 years from the act of violence to make an application to Victim Services, and they may be entitled to a recognition payment of $5,000. The injury to the victim can be physical or psychological, or it can be both, and we know that that is often the case, that the ongoing effects, the psychological effects for victims of domestic violence can, a number of years, if not a lifetime. Our service aims to provide clients with advice around the timeframes required to lodge applications, and also assist with gathering evidence, or at least giving the clients what evidence, knowledge about what evidence that they need to make available to Victim Services with their application. For recognition payment to be made, the applicant is to provide evidence of the act of violence. So this can be done by way of a police report, which we previously said, and also evidence of an injury. So there needs both components. So evidence to a government agency and then evidence of injury. Evidence of injury can be provided by a doctor, counsellor, social worker, or just simply by obtaining medical records from the hospital. An assessor from Victim Services assesses each claim based on the application and evidence provided. A decision is made on the balance of probabilities, which means that the assessor must be satisfied that it is more likely than not that the act of violence occurred and that the injury resulted. A perpetrator of violence does not have to be convicted of an assault for a recognition payment to be paid, but recognition payments do take a lot longer than immediate needs. They take about 9 months to be assessed and processed. Where a perpetrator is charged by police in relation to the act of violence, victim services can make what's called a restitution order. So this is a little bit like a fine that is implemented through Revenue New South Wales, and it's in the sum that was paid to the victim. So if victim services paid a fine, paid a victim of domestic violence or victim of a crime an amount of $5,000, a restitution order can be raised for that amount. With domestic violence victims, though, it is important, I guess, that they understand that those restitution orders can be waived where the issuing of that order might result in further risk of harm to the victim. Victim services try to award payments. So they go out of their way to try and award these payments. They may ask for additional information to even support the victim getting a greater category of sum of money and want to approve them in the victim's favour. So the more information that can be provided to victim services, the better. It is a process and a forum where victims are believed and that violence is acknowledged. As many of you may have come in contact with victims of domestic violence on a day-to-day basis, it is nice to be armed with some knowledge of the supports available and where clients can seek the right advice. Our service, and I'll just share my screen, which I meant to do a little bit earlier, just to show a little bit about our service. So as you can see, we've got offices in Port Macquarie and Coffs Harbour. We're a free service, so I'll just put that out again. We will talk to anyone, we'll advise anyone in the first instance. Anyone can give us a call, and we assist with civil law matters, and I'll show you a number of the different things that we can do and give advice on. But today I've just focused on a couple of the services that we provide surrounding domestic violence. If anyone would like to contact us just to have a general chat about our service, or if you've got some questions or want to know how to refer someone to our service, please feel free to contact us. Our number is, for those who are just listening, is 65802111, and we can also be reached on our email, which is info@mncclc.org.au. Thank you so much for allowing me to share what I do and what services that we can offer in the community, and I acknowledge that this forum is a great platform to have a taste of all the services, and appreciate the time and efforts of all the organisers going into this. Thank you very much.
Thank you very much, Kelly. We're moving now into the final R, the most important R. This is about restoring yourself as a worker, as an individual, as someone who walks beside victim survivors, as someone who may have experienced violence themselves. So I'm really pleased to introduce David Duffy, who's the Coordinator of Violence, Abuse and Neglect in respect to education and training with New South Wales Health, to talk a bit more about how you can apply a trauma-informed lens to your own self-care. Thank you.
Good morning, my name is David Duffy and I work for the Mid-North Coast Local Health District. I'm the Coordinator of Violence, Abuse and Neglect, Education and Training. I appreciate the opportunity to contribute to this important online forum supporting the 16 days of activism against gender-based violence. Today I'll be speaking on how you apply a trauma-informed lens to your work and to your self-care. Firstly, I'd like to add my acknowledgement to the traditional custodians of the land. I acknowledge their historical and present-day experience of trauma and resilience. In this slide, I've chosen an illustration. Suppose you visit your local hospital or GP due to breathing difficulties, but first you have to walk 30 metres to get to reception. When you arrive at reception, you're asked to explain your concern while you're still catching your breath. Soon your breathing stabilises and you see a caring doctor who listens to your concerns. You're then prescribed asthma medication and given an asthma plan that contains various lifestyle recommendations, such as no smoking. You leave the doctor and return home where your partner is smoking in the lounge room. You also notice excessive dust and mould on the blinds. In this simple illustration, the service overlooked and aggravated the underlying problem, even if it wasn't intentional. And likewise, similar dynamics can play out in the way services respond to people who experience trauma, such as domestic and family violence. And a trauma-informed lens can help both services and staff to respond sensitively. There's a background to this session. We know that domestic and family violence is a significant issue in our community. Multiple service sectors work with people who have experienced this common but distinctive form of traumatic experience. Services vary in their responsiveness to these traumatic experiences. Some are restorative, while others can actually re-traumatise. And re-traumatisation occurs when an interaction, procedure, or something in the physical environment replicates a traumatic experience, literally or symbolically, according to Jennings and Samsa. This doesn't have to be intentional, in fact. Doing business as usual can exacerbate trauma issues for victims of domestic and family violence. For this reason, academics and trauma professionals have been advocating for a trauma-informed approach. Samsa describes a trauma-informed approach as a program, organisation or system that realises the widespread impact of trauma and understands potential paths for recovery, that recognises the signs and symptoms of trauma in clients, families, staff and others involved with the system, and responds by fully integrating knowledge about trauma into policies, procedures and practices, and lastly, seeks to actively resist re-traumatisation. Mid-North Coast Local Health District is also supporting a cultural change throughout the LHD by adopting a trauma-informed approach, workforce training strategy across key frontline health services. This includes targeted training at managers and staff at a level commensurate to their role. And to further support this trauma-informed approach, our LHD has partnered with the National Drug and Alcohol Research Centre at University of New South Wales to further implement and evaluate this strategy. The aim of this session is to use a case study to introduce or remind domestic and family violence workers of the importance of using a trauma-informed lens. This is just one component of a trauma-informed approach. There still needs to be change at an organisational and systems level to sensitively respond to victims of domestic and family violence. The following case study depicts domestic and family violence, but it does not represent a real person. It's going to be used for instructional purposes, and I'm not going to specify a specific job role because the purpose is really to look at a trauma-informed lens in application. You receive a new referral from the local hospital social worker. Thank you for considering this referral for Miss Jenny Study. The background is that Jenny, 30, and Pete, 33, were in an off and on relationship for 4 years. Pete's domestic violence included physical abuse, including grabbing, pushing and hitting, psychological harm, belittling and threats, and socially isolating Jenny from her parents and netball friends. The last reported incident involved Pete grabbing and breaking 2 of Jenny's fingers. Jenny attended treatment at the hospital, and since being discharged, she has been staying with her parents. While in hospital, Jenny ended the relationship with Pete, and he hasn't contacted her since. Over the last 6 months, Jenny has reconnected with her parents, since she moved in with them after escaping Pete's use of domestic violence. As we continue, let's see how we can view this domestic and family violence situation from a trauma-informed lens. Jenny has been going to the pub every second night, getting intoxicated and occasionally not coming home until the next day. With a trauma-informed lens, we consider Jenny may be seeking connection with others, or Jenny may be trying to establish some routine. Jenny said she has a very busy mind and drinking helps her to slow down. With a trauma-informed lens, we consider the potential for trauma reminders, that trauma affects cognitive functioning, and Jenny is trying to numb or avoid trauma symptoms with substances. Jenny said she frequently argues with her parents about her drinking because they are overbearing and have always tried to control her life. With a trauma-informed lens, we consider trauma affects our ability to regulate emotions. Jenny has been controlled by Pete's domestic violence, and this may reenact in her interactions with family and staff. Jenny may overly comply with others, or she may react overly defensive to well-intentioned recommendations. Jenny said she has no close friends and has seen many counsellors, which hasn't really helped. With a trauma-informed lens, we consider Pete's domestic family violence has cut Jenny off from others, and this trauma may affect her ability to trust others and establish and maintain relationships. Trust issues may also play out in Jenny's ability to engage with services. Trauma-informed principles can be helpful to support victims of domestic and family violence. They include safety, trustworthiness and transparency, peer support, collaboration and mutuality, empowerment, voice and choice, cultural, historical and gender issues. Now, these principles provide a response that is opposite to domestic and family violence. We can also take a trauma-informed pulse. One tool that services can use to begin taking this trauma-informed pulse is the Trauma-Informed Practices Scale, or the TIP. There are many other tools, but this one is unique because it obtains the perspective of clients. The TIP scales assess 6 domains of trauma-informed practice: environment of agency and mutual respect, access to information on trauma, opportunities for connection, emphasis on strengths, cultural responsiveness and inclusivity, and support for parenting. For this second part of the session, we're going to consider applying a trauma-informed lens to self-care. There is increasing awareness that working with interpersonal trauma is an occupational hazard for psychological injury. One risk includes vicarious trauma, whereby someone in a helping role experiences negative changes in their worldview which stem from repeated exposure to the traumatic experience of others. And this can happen to any of us who work in the sector. It's not a sign of weakness. A closely related term is secondary traumatic stress, and this happens when we experience specific trauma symptoms from working with trauma. This could include nightmares and flashbacks of stories we hear, hyperarousal, or avoiding things that remind us of the trauma. This work is undoubtedly challenging, but there are also positive benefits that can develop from working in this difficult space. Vicarious resilience occurs when we personally develop positive changes and growth through witnessing the resilience and post-traumatic growth of others. Unfortunately, vicarious resilience doesn't occur naturally. Some people will be sorely affected by the work, and it will impact their personal well-being and their effectiveness in helping others. Therefore, practicing good self-care is essential to ensure there are protective factors for this work. This is our personal protective equipment in the workplace. It's putting the oxygen mask on us first. It's difficult to maintain, but we owe it to ourselves, our families, and the people we work with. So on this slide, there are some self-care strategies that are good for anyone in a helping profession, but they are especially important for those who are regularly working with trauma, like domestic and family violence. We can request regular supervision and consultation. We can utilise peer support and collaborating care. Set realistic work goals and expectations. We are contributing to change, not forcing it. Seek continuing education on trauma, vicarious trauma, and resilience. Utilise employee assistance programs and wellbeing initiatives. And we may access therapy for unresolved trauma because sometimes the work may be triggering us. Implement a self-care plan for a healthy work-life balance. A trauma-informed approach is beneficial for the well-being of our workforce too. It's not just good for clients. In fact, a trauma-informed care outcome study by Hales in 2018 found statistically significant improvement across organisational climate, policies, procedures and practices, staff satisfaction, client satisfaction, and client retention. And a review by Mid-North Coast LHD staff in the mental health space demonstrates that trauma-informed care can actually support a positive organisational environment and improve consumer experiences of care. Today I've tried to condense 2 fairly large topics: applying a trauma-informed lens to domestic and family violence work and to our own self-care. I appreciate that many other speakers on this forum will help fill in the gaps. But in closing, I want to thank and encourage all those workers who continue supporting victims of domestic and family violence. And I hope we can continue to support each other and be sufficiently resourced to continue this very challenging but rewarding work. Thank you.
Thank you so much to David, and please take the resources and information he's given to take care of yourself in the work that you do. And I wanted to express a big thanks to everybody out there around the work they do supporting your clients and community members. We're going to take a bit of a different focus now. We've been talking lots about, I guess, clients in the typical sense of the word, but I want to introduce Brooke from Liberty Domestic and Family Violence Specialist Service, who's going to talk about a different type of awareness that is really relevant to all of us in the room today around the impacts of domestic and family violence in the workplace.
Thanks, Taryn. Okay, so much of today has been about recognising and responding to domestic and family violence as it relates to your client work. And we are going to spend just 10 minutes or so together this morning to talk about what we need to do in the workplace on how to respond safely to colleagues who may be experiencing domestic and family violence. So with COVID-19, obviously the boundaries between work and home started to blur, and we started to understand that perhaps what was happening in the home was more impactful on the workplace. So the workplace had traditionally been a buffer or a safe place for many people who were experiencing domestic and family violence. So Safe Work Australia identified or updated their national guidelines for safe workplaces, and for the first time they included domestic and family violence obligations. And there are 5 main obligations that workplaces need to consider when they're looking at responding to this issue of domestic and family violence in the workplace. So the first one is that workplaces or employers are responsible for making sure that their employees are not exposed to risks, and that includes domestic and family violence. So if you're working from home, maybe you are still doing a bit of work from home, maybe you've transitioned back, whichever your working arrangement, there is an obligation that extends to the home or wherever you are working. So that also includes having a really robust process for identifying risks to employees' health and safety, and being able to mitigate those risks. So again, creating safe spaces for disclosure, ensuring confidentiality, and really making sure that employers aren't asking for more information than is necessary in order to keep their employees safe. The second obligation is to make sure that leaders explicitly say that domestic and family violence is a workplace issue. And so that includes having policies and procedures and resources and things that leaders and everyone in the organisation can refer to if there are some colleagues experiencing domestic and family violence. So a part of that is also making sure that there are support networks available, so EAPs. Are there wellbeing champions that have specialised training in how to safely respond to their work colleagues or other people in the organisation? That also includes making sure, for point number 3, is that employers make clear to their employees what benefits are available to them. So there's unpaid and paid leave, there might be other psychological services, and connecting them in with specialised support services in their local area. So employers, it's not on them to know who all the experts are, and today you've heard a lot about who it is in this area that you can reach out to, but it is about making that connection and providing that information, including 1-800-RESPECT. The fourth pillar or obligation of employers is around providing awareness training. And so this is one thing that has not been on the radar of workplaces in the past. DFE has been seen maybe as a HR issue. Maybe there hasn't been much disclosure in the workplace. It hasn't felt safe to do so. So providing that general awareness training equips everybody with a level of awareness that they can start to recognise what some of those signs are. And so for you might already be quite adept at recognising the signs because you see it in your clients. You also respond to that. But it's different when it's a work colleague. It's different when it's someone sitting next to you who you know really well, and it can just add complexity and make it quite difficult to know what the best thing to do is. So really having that level of training for everyone also lifts the general psychological safety of an organisation and gives everybody a basic skill set in terms of responding to domestic and family violence. So the last thing is, I guess, is thinking about your policies and procedures and resources. Are there things that people can relate to? Are there safety plans in your organisation? Is there flexible working arrangements? And so really starting to think, is the organisation not just set up to identify or manage that risk, but what happens after that fact? How do we support that person ongoing? Because we know domestic and family violence is complex and it can go on for a long time. So it isn't just a once and done kind of support. There might be legal appointments, there might be school appointments, a whole bunch of other things. And so also leaders need to understand, how can you manage team culture in that space? When you might need to be, you've got somebody that is absent a lot, or maybe they're not producing the same amount of work, and colleagues are having to pick up their workload. So there are some nuances for leaders especially. So if you are watching and you are a leader, it is something to consider. How can you maintain that confidentiality but provide that ongoing support for that person? And then of course, if you have perpetrators in the workplace, what are the processes around that? So those are just some of Safe Work Australia's guidelines, national guidelines for safe workplaces. And I guess in response to that, Liberty has introduced a new program called Everybody's Business. We were already delivering this kind of education in community, but now it is tailored in line with the COVID safe guidelines. So what we do is we provide a general awareness training to employees of any organisation, and then we also provide some tailored training to anyone in the organisation who might be specialists or might have to more closely respond. So that might be leaders, that might be wellbeing champions, whoever it is that you want to be the first responder within your organisation. And then, of course, human resources support around developing policies and procedures and appropriate resources that help us, all of us, create a safe space for disclosure, and that support and secure internal pathways for reporting and safety planning and all of those things. So if you're watching, you may not be a leader. You may not be able to make decisions around, engaging in training for your organisation or becoming a champion, or even influencing policy and procedure. But we all can play our part as colleagues to encourage our organisations to have these obligations met within their workplace, and to make sure that we safely respond to colleagues who may be experiencing domestic and family violence. And it is a different lens, it is a different hat than client work, so it is something to consider. I think the last thing I want to say is that beyond responding safely or recognising DFV in the workplace, I think workplaces play a special role in addressing the drivers of domestic and family violence. So we know that there are gendered drivers of domestic and family violence, and workplaces create cultures where they can challenge some of those gendered drivers to make real change. So workplaces can actually play a role in the prevention piece of domestic and family violence, and in fact I see that as one of the most important parts. If we really are going to shift this and make this a dent in the issue that is domestic and family violence, then we need to be doing something right at the start. And we have worked with many organisations that are really leading the way in terms of how they tackle that kind of culture within their organisation, how they challenge some of those drivers and stereotypes, and really role model to the rest of the community that this is what they expect. So we can definitely support workplaces in their values, guidelines, and a whole bunch of other things that can lead the way there on some cultural change. So plenty for us to do, both as colleagues. If you're watching and you're a leader, you can definitely make some choices around not only meeting your Safe Work Australia guidelines, that's the buy and the buy, I think. It really is about looking after our people in our workplaces. This work is tough going, and it's one way that we can support each other and also make a difference. So, great. Thank you.
Thank you so much, Brooke. And I believe that people can get in touch with Liberty if they wanted to explore some of those opportunities to implement some of the training and consultation mentioned. So that actually concludes our first half of the agenda. We've taken you through our 5 R's. We're going to have a short lunch break now. We're going to be back though to really explore some other areas of domestic and family violence. We're going to hear from some really phenomenal speakers and practitioners in the area to give you a bit more information on some aspects of domestic and family violence that you might not be so familiar with or you might want to know more about. So we will see you in half an hour and please enjoy your lunch break and we'll be back momentarily. Welcome back, everybody. I hope you've enjoyed the morning and that you've had a lovely lunch break. And thank you very much for your patience as we just organised some additional video footage. I'm so happy to welcome back Auntie Maddie and Michelle to do a presentation. It's going to involve some videos as well around how domestic violence impacts Aboriginal communities.
Thanks, Taryn. Before we start talking, we thought we would take everyone back in time to 2016, 2017, where Samaritans embarked on a new journey of how to engage with our Aboriginal communities and what it means to work with Aboriginal women in particular who are affected by domestic and family violence. So if you can hit play on the video, and then Auntie Maddie and I will have a bit of a yarn with you afterwards. I'm Michelle Stocks, I'm the Community Services Manager for Samaritans, and I look after the majority of the services other than disability for the Mid-North Coast. So when the going home, staying home reforms were introduced and the concept of women's refuges changed, Samaritans took over the contract from a women's only service for women's refuges. And it did cause a lot of serious issues and mistrust within the community, which impacted on women accessing the service. We had women fearful to access the refuge. We had women fearful to contact the police to report domestic and family violence, and a real sense of fear that they may lose their children if they report that violence. So when I came on board to Samaritans and I was recognising the low numbers of people that were accessing our service, I thought we have to do something. And what is it that we can do? And any service that works in a community such as a community of Kempsey that is predominantly Aboriginal population is higher than non-Aboriginal. There is more statistical socio-economic issues in the Aboriginal community. Speak to the Aboriginal community. What is it that's going wrong? What are we doing wrong? And what do we need to do to fix it? So I approached one of the Aboriginal organisations which is called Guru Galvins, which is coordinated by Auntie Maddie Donovan, and every year she runs what's called a yarn up camp, which is for the Aboriginal women that come together for 3 to 5 days just to talk about community, to yarn up, to get together, socialise. And I asked her, could I come? Could I come and meet the women and ask them directly, what is it that is going wrong? What do we need to do to make Kempsey not the state's second highest rate of domestic and family violence in New South Wales? And thankfully she said yes. And that started this whole relationship.
At our last Yarn Up camp, which was in Stewart's Point, a lot of the women got together and were talking about the concerns they have in their communities. One of the major concerns was the domestic violence. What do they do when their children are being beaten, and how do they support them, and what happens with their grandchildren which may be removed? And from there, the women, when we spoke about all the violence in our communities, the women wanted to write a letter of all the concerns they had. So Michelle sat down with the women one by one and they read out their concerns and we put it in a letter.
And I put their words down on paper and they all signed that letter. And they signed a letter and it went to Inspector Paul Theon and it went to the Manager for Family and Community Services, which we called the Petition of Change. And predominantly it was, enough is enough. We are strong women, we're strong Aboriginal women, and we're going to stop our children, our grandchildren, and we're going to stop this cycle of domestic violence. Is every single woman that attended the forum signed that petition to say that they want change, and they will participate and support facts and police to make that change happen.
The Superintendent Paul Theon, I'm the local area commander at the Mid-North Coast Local Area Command. Our area encompasses areas such as Port Macquarie, Kempsey and Nambucca, and in our Kempsey area we have a high Aboriginal population. One of the main things that we've been doing in partnership is meeting with our Aboriginal community at our PAC meetings, and over the years we've seen a real shift, and the shift has been where the community has had their concern for domestic violence in the Aboriginal community, and it's wonderful to see the elders that are leading in that community to have such a strong focus on it. As police officers, we've made it our #1 priority. We need to be working with the community out there, and whilst we're looking for offenders and trying to protect victims, we need to have support services.
And this is where it all began. And through that petition of change, what we recognised is a historical trauma of the women's refuge, of women that did go there, that did experience their children being removed, not necessarily getting the appropriate supports that they needed. And what is traditional and appropriate in a community such as this is relying on your grandmothers, on your aunties, on your sisters to support you. So the elders committed to working with us so women would feel safe to come to us. So that brought about Samaritans saying, you know what, this is Kempsey Women's Refuge. This is your refuge. It belongs to you. You own it. Let's make it happen. And that's how we started.
I think with the renaming of the refuge, it brought the women together again. It was a follow-on from the Yarnup camp. And I think one of the most experiences that I had that I could never forget, it was the first time we danced as an Aboriginal group of women. No one has ever danced there before, since the old days. And all the women loved it, you know. And we've named the refuge now in an Aboriginal name. And I think this is going to bring more women to our refuge. There were some issues before about the women going to the refuge, but I think having an Aboriginal name and smoking it and the women dancing there has now put it out in the community that it is safe to go there.
Because it was never around when I was young, and it's good that it's out in the community now, and people are starting to recognise domestic violence and what it means. That you know that there's a lot of help out there, and you don't just have to keep it bottled up to yourself. You know, people, you can go to people, and you know you're going to get the right help.
Recently we were present at the renaming of the Samaritan Women's Refuge, and I was very impressed with the elders from the Aboriginal community, and that being the female elders, that showed a very strong commitment to the welcoming and opening ceremony in relation to supporting victims of domestic violence. And we haven't seen that over the years, the open commitment by those Aboriginal elders to say that domestic violence will not be tolerated, but more so that the victims will be supported, and they'll encourage them to be supported in the community.
And the healing ceremony was a really powerful experience, and I will never forget all the women made their own screen printed smocks that we wore as we walked into the renaming ceremony. And one of the elders said, do you know this is the first time that the women have walked in first? And it's something that stayed with me, and I think that's what I want to continue through working with Auntie Maddie and services, is that we as women, and we're strong women, are going to continue to walk first. We are not going to walk behind, and we're going to continue to make change. We're going to continue to stop violence, and we're going to continue until Kempsey is no longer ticking the boxes for the wrong reasons, but ticking them for the good reasons. Come over here, Auntie Mad.
Should have got a tissue.
Yeah. That's 4 years. 4 years feels like yesterday. Feels like a long journey, but one that we haven't stopped, and I don't think we'll ever stop. I think a reflection of us sitting here today, again with Auntie Maddie, 4 years later, she gets a phone call from me and I said, what do you got planned? And what can we share with other services? What can we share with other communities about what it means to make change? Especially everything you've heard today has focused on Aboriginal women being the highest proportion of victims of homicide, of children going into care. Enough is enough. And 4 years later, we're still going to keep fighting the fight. But we want to say that we've hung in there, and it is a long journey, and that's part of what we wanted to share with everyone today. And I've asked Auntie Maddie to sort of share her knowledge and her experience about what do communities, what do services need to remember about the challenges of working and living in an Aboriginal predominant community where domestic and family violence is still relevant.
Still very relevant in our community. I think there's still a lot of fear with our women and our grandparents, our elders, because as you all know, we do come from a very traumatised generation. Our families and our kids, our friends, have always been put in care and homes, Kinchler boys' homes and things, and you know, all that trauma is being passed down to all our younger people. I think they're very scared of the police because of the Black Lives Matter thing and that. And I think a lot of times we've taken them to the police, they wasn't serviced properly. So our women don't want to go to the police. And it's not only because the fear of police, but it's also the fear that repercussions can happen at home with the family of the perpetrator. You know, and well, another thing, our people are very disadvantaged, so there's not a lot of them that work, so they have only Centrelink as an income. They have a family away, you know, parents might be away somewhere, they can't get down there, no cars, the kids there to look after. So they stay. And a lot of the saying was when I was growing back that you made your bed, you got to lie in it. You know, and that's a saying that a lot of us believed in.
Yeah.
Until now.
And that's certainly what the whole premise of relying and bringing our elders into the refuge and saying, walk with us, support us to support our women to feel safe, that they aren't going to be shamed in their community, they aren't going to be ostracised, because that is as equally traumatic and a big fear and a realistic fear, and still is quite relevant for women who do speak out. So we have our elders and our aunties who come to the refuge, and they might just hang out for a few hours. If we've got a client that is struggling to maybe make that change, we've got elders with their permission that they'll reach out to, and it's someone from their community that they feel safe with, that they can feel supported by. And what we haven't talked about is one of the things that this brought about too was we worked in conjunction with GMARS, Grandmothers Against Removals of Children, and we also developed the local advisory group, which identify specific women elders in the community that DCJ will work with to stop children being removed when there is domestic and family violence, rather than that child being removed. So in the first 2 months of us setting up the LAG, we had 4 children that were placed with family rather than being put into care. And that's just been a continual journey.
I think there was quite a few children now that haven't gone into care. What generally happens if they have concerns about a child that's experiencing DV in the home, they will ring one of us. Fax would ring one of us and we'd come in and talk, and we'd say, no, we need to get the family in here and see if there's a family member that can take this child while we work with the parents or the mum, or we call a group conferencing. So now, we sit on DCJ's flowchart. So when a concern comes in, they will go down there and say, this is an Aboriginal family, we need somebody to come in, and see where the family, get hold of the family so we can have these meetings. And I just thought, with a lot of women, when they come in to see someone, even maybe Aboriginal workers, they're coming in very frightened. So I just say, I'm offering and encouraging clients' participation, offer information, support and advocacy, informing choices, giving options, establishing control of their own lives, self-care, letting her drive the ship, letting her make those choices, offering a cup of tea. Where does she feel comfortable to tell her story? It might be in the park, it might be in the bush, or walk somewhere. Acknowledging their religious beliefs, and always encourage the client's participation. Working together also as part of a team to get the best outcome, but always walking beside her in that journey. Not behind, not in front, but beside her. So she feels an equal person to us when we're going through all that process. And respecting her choices. It may not be that she doesn't want to leave, but we respect those choices that she wants to make. Working together with other services to get a good outcome. Respect their boundaries. Normalising her guilt and shame and fears. Acknowledging her grief and loss. Of course, when they do leave that partner, it is a big loss to them, and they grieve for them. A lot of them think, well, I can't make it on my own, you know? Who's going to be there to help me with the kids? But that's when us as grandmothers and elders in the community will step in and help them. Yeah.
And that's probably the biggest achievement that we can say, and the biggest suggestion we would give to services and people that are listening today is reach out to your elders in your community. Your women elders have walked a path that none of us could ever have dreamt of, let alone survived possibly, and without the support of the elders, we aren't, Kempsey is no longer second highest rate of DV in New South Wales. We have certainly dropped down that ladder. Slowly but surely it's making change, but it's making change because we aren't doing it on our own. We're doing it as a community. As a community, we're saying DV is not acceptable. DV won't be tolerated and we won't make excuses. And if you do make excuses or you don't report, that's not going to be accepted. So the shift has changed. We just got to keep walking that walk. Okay. And as we said, 4 years, we're still walking it.
Still walking it, yes. But, you know, in those 4 years, I've seen a lot of people, a lot of women leave and have a better life. You know, I've even taken women in from DV and kept them at my home to keep them safe. So there are some good outcomes, but there's also been some bad outcomes. And I just think, you know, to pay tribute to all those women that have passed through DV. So it leaves a very big gap in our community when that happens. A lot of grief and loss.
Thank you. Thanks, Taryn. Thanks.
Oh my God.
Thank you.
Thank you so much. Thank you, Maddie. Again, left a bit speechless. That was a fantastic journey and exploration, and again, a heartfelt thanks again to Auntie Maddie Donovan for her support of today. Now we're going to change gears again a little bit and talk about men's behaviour change. Men's behaviour change is an emerging sector and certainly, in my view, a bit of the missing piece of the puzzle. It's a challenging area, it is a complex area, but it is an essential area. Violence against women will stop if men stop being violent, and I'd like to introduce a group of dedicated professionals from the Mid Coast Consortium, which is made up of Kempsey Families, Warina and Liberty. So I'm very pleased to introduce the Men's Behaviour Change session.
Firstly, we would like to acknowledge the traditional owners of the land we are on today, the Wurundjeri people. We pay our respects to the elders past, present and emerging, and the spirits of the land. Hi, my name is Shana and I'm a worker at Warina Domestic and Family Violence Specialist Service. I am a women and children's advocate for the Engage to Change program. I become involved with women and children that have been impacted by domestic and family violence after a man has initiated contact with either the Men's Behaviour Change program or the Fixed Address program, or could be engaged in both. I offer DV education, information, advocacy, support, and referrals to appropriate services.
Hi, I'm Renee and I'm from the Fixed Address program at Warina. I provide individual case management for men who have used violence and abuse in their intimate or family relationships, and they are seeking change. Shana and I work together collaboratively in providing a wraparound response to domestic and family violence in Coffs Harbour.
We are grateful for this opportunity to speak with you today and highlight not only the importance of accessing this portion of the population, but how you as service providers and community members can play a role in enhancing men's access to the specialist behaviour change service. In whatever role you play in our community, you may find yourself positioned to provide an appropriate first-hand response to a man who has used domestic and family violence.
So when we talk about men's behaviour change services, we are talking globally about those services that work with men who use violence and abuse in their relationships, either individually or within a group space, through the use of therapeutic and psychoeducational strategies that support them to re-examine not only the behaviours that they're using, but also those beliefs, attitudes and thoughts that drive their choice to use them. Because it is a choice a man can choose to stop. He just may not know that yet, and it may not be in his field of vision, or he may not be ready to admit that even if it is. We are also talking about the services who walk alongside the women and children and who are impacted by the man's choice to use violence. The survivors we meet, or Shana works with, have experienced domestic and family violence. They're not responsible for someone else's behaviour. The burden and the pressure should not be placed on the survivors. The sole focus should be on the abuser, and it's up to the men to change their behaviour. What people often wonder, though, is why we need to increase men's access to domestic violence intervention services.
I think this is best answered by sharing with you my work and advocacy for the women and children whose lives can be forever altered by your commitment in increasing the access of men to intervention services. The work with men cannot occur safely without engaging the women and children impacted by his choice to use violence, control, and we need to prioritise their safety. For a woman and children's advocate, it is such a rich space to be part of. Once I receive a referral from one of the men's behaviour change services, I prepare myself to make contact with the women who has been impacted by his violence. Some women are not aware that we will make that call, as they may have separated and have no contact. Some women are aware as they are still in the relationship, and some are aware because of shared children. All these women and children have one thing in common. They are survivors of domestic and family violence. All their stories are unique, and all their needs vary depending on different circumstances that they have faced or are facing. Women I speak to are facing so many life's challenges because of their current partner or former partner's choice to use violence. You may ask what engagement with women and children look like. It is invitational for the woman. She can decide and regain her sense of control by letting me know how often she wants contact, the frequency of the calls, and time that suits her and her children. This is very empowering for the woman. She identifies the supports that her and her children need. She will support her children at school. We don't always see them, but she can use to have our support wrapped around the children as well. The voices, concerns and worries are validated through our advocacy in the states. Their strengths and abilities are is able to feel safe in a confidential area that we, if she has other services involved, we respect that and walk alongside her with the engagement with them. She is able to develop her own autonomy in navigating other systems such as family court matters and mediation. When she identifies further supports that will help her, we are able to make referrals to the appropriate services. As she navigates her own journey of healing and self-discovery, we will walk alongside her for as much or as little as she chooses. I am often overwhelmed as I observe women develop their personal strength and increase confidence by having this support wrapped around them, their families, and at times their partners when they are still present in their space. It is rewarding to watch them find their voices, to be able to use their voices for themselves, use their voices to advocate for their children and for seeking justice. Each individual woman has her own story. It's in the work we do that we notice women begin to reclaim their own identity and increase their space for action, whether they decide to stay in the relationship, leave the relationship, or have already left the relationship. It's their decision, and we will support them the best we can. And it will have a positive effect on the children and her capacity to be a mum. We often hear in being a women and children's advocate, women say, I love him, I want him to change. I want the man I am in love with, the man I need and want and deserve. I want my children to have a dad they deserve in this world. I just want his abuse and violence to stop.
And for the man, that is what accessing specialist domestic violence interventions such as men's behaviour change programs can support him to do for himself. I noticed earlier in the chat that it was asked about the outcomes for men who have engaged with our services. We have seen men enter programs homeless, unemployed, struggling with substance abuse issues and socially isolated. They are in financial, legal and psychological stress and have had little awareness of their use of domestic violence against their ex-partners and children. They have left with stable accommodation, employment and greater stability in most areas of their lives. Now, we do acknowledge, however, that these changes do not come without the man strongly committing to travel a difficult and at times demanding journey towards a more ethical and accountable life, a journey that can commence when they are able to access these services. So how can you actively support increasing men's access to support? So let me set a scene for you, because there really is no one type of perpetrator or man that uses abuse. He may look very different to what you have seen in the media or the movies or even in your experiences. Quite often we see on the media after a significant event that people close to the man were shocked because he was a good man. He was always happy. He seemed kind to neighbours. When he sits in front of you, he may have minimal eye contact. He may be shy in using words like ABO or charges. He may not even say he has been violent or make any reference to domestic violence. Most often he sits filled with shame. Often he is filled with pain and trauma and addiction. He may be lost, confused and disassociated. He may have no home, no money and no support. And he may have come to you due to a mental or physical illness, due to financial distress or some other issue. He may have hurt someone. He may have hurt someone really badly. But in that moment of time when he sits before you, he is a person that needs your help. And the partner or the ex-partner and their children that sit behind that man also need your help. So I guess, how do we engage with a man to support him to follow that path of reflecting on himself and accessing the services that he needs to support that process? I think firstly, be mindful that he is a person. When you engage with him, you role model respectful interactions with the man. Consider offering empathy and active listening. Definitely avoid accusations or judgments, arguing or challenging him. Not only can this result in an unsafe situation for you as a service provider, but it may also result in him disengaging or resisting support. And that may mean that he walks away and doesn't access. Big trick that might happen is to be mindful that he could invite you to collude with his narrative. So man might have a story that involves justifying the actions that he has used. So he might be saying something as simple as, I don't know what happened, I just snapped, I just lost it. he might try to minimise the situation. You know, I got out of control, that's all, it was just this once. He may try and blame his partner or ex-partner. You know, she just knows how to push my buttons. And he may try and excuse the situation, excuse the behaviour. I've just been so stressed, I just got frustrated, that's all. I'm not that type of person. Look out for these signs and look out for the way that you respond to them. By interacting with a man during these things, when he says things like this, he's consciously or unconsciously inviting you to collude with his narrative, which means you can empower his position. But you can also disempower his position in those times, using empathy and using active listening, and looking more towards the needs that he's presenting at.
Responding in a way that is safe and encourages him to be accountable for his choices and be open to exploring them is crucial. Any response you give a man by referral offers women and children the valuable opportunity to receive support services wrapped around them. Risk and safety assessments are ongoing and monitored all the time. Important discussions are always led by the woman who prioritises her and her children's safety. The women I speak to are the experts in their own lives. They are the ones, before engaging with us, that kept her and her children safe and will continue to do so, guided by us. So I want you to all know you play a pivotal role in helping the women and children that are in his life, the ones behind his use of violence, who are impacted by his choices, who need your help to help him, so them and their immediate world can become a safer place. Whilst you cannot see her, whilst you cannot see her and the children are not sitting in the room with him, I want you to take this time to imagine that she is there. We urge you to think of her when you speak to him, because what you do in that moment can have a ripple effect for her and the children involved.
What conversations you have with him, and you can contribute to him taking responsibility for himself and being accountable, will also support the safety of women and children. And quite often Shana and I engage in that in a collaborative way. Women will feed concerns about risk to Shana, which will be fed to me. And if I discover or am concerned about an escalation around a man, then I can notify Shana, and safety planning can occur around that. So having a wraparound response means that we can prioritise that safety while working with the man about the issues that he is dealing with at the time. So please consider these questions and check your toolbox and put this flow chart in it. So how do you assess and prioritise risk? What do you notice? What is important when assessing this man? What do you listen out for? So when he's sitting in front of you, he's come in, maybe he's homeless and he's come in for some help around housing. What do you listen out for? How recent was that homelessness come around? He may mention that he had an ABO and that he was taken by the police. Does he seem escalated at the time?
Is there a pending pregnancy, or has there been a recent separation or a planned separation that he is aware of? How is he referring to his ex-partner or partner? What sort of language does he use when he speaks about them and children?
Is he suicidal, or do you have any concerns about his mental health? Is there drugs or other or alcohol involved? Is there something that might impair him in making the choices to stay safe? These questions are considerations when you're making those assessments around risk for that person and for anyone that he has contact with. So how can you contribute to safety? Has he mentioned anyone else in his support circle? Has he got current supports? Will he give you consent to exchange information with them? In the work that we do, we'll refer to that as a web of accountability. They're people that interact with him. They're people that hear his narrative and they're people who you can collaborate to ensure that the response that you provide is integrated and holistic. So you as a responder, how do these interactions impact you? Because they're not easy. As we said earlier, there is a man that sits before you that has hurt someone and could have hurt someone really badly. So as a human being, how does that impact you? And how can you resolve that kind of internal conflict that might arise during and after your interaction with a man who has chosen to use violence and abuse? Quite often that can come up, and it can create sort of that internal dissonance that makes it feel a little bit icky. But as I said, there's a person, there's a human being in front of you that needs help, but there's also people that aren't in the room that also need that assistance, need you to provide that assistance for him. And I guess, with that in mind, who supports you? Given that DFV is everyone's business, we're all aware that there's an overwhelming number of domestic and family violence incidents that are reported, and whatever is not reported is there too. Whilst we are a specialist service, we cannot do it alone. It's an issue that requires a whole of community integrated response, and every opportunity to support a man to open the door to change potentially can disrupt the trajectory of domestic and family violence in our community.
So our message to you as a service worker, a friend, a co-worker, a family member, whatever role you play in our community, you can do something to help, not only with the circumstances a man presents to you, but also those choices that may have led to the outcome he is experiencing.
And as I said before, DFE is everyone's business, and we invite you to play a role in enhancing access to the person who can stop DFE in its tracks by choosing not to use it. In the Mid-North Coast, we're fortunate enough that there are options for referral to domestic and family violence specialist services, being one-on-one case management programs, a 12-week group program, and the men's referral service, which is a national service that offers one-off or multi-session interventions by the phone. The local services all involve support to women and children that are impacted by men's use of violence. And I believe we now may have a recording from Cameron, who works at Liberty Domestic and Family Violence Specialist Services, and he is going to elaborate further on what the engagement looks like with a man after the referral has been made to one of our specialist domestic and family violence services. Thank you.
Thank you.
I think this is recording. I hope it is. My name's Cam McKinley-Rogers, and I work as a men's behaviour change specialist here in Port Macquarie at Liberty Domestic and Family Violence Specialist Services. I'm lucky enough to work across two programs that we offer here, which we do across the Mid-North Coast Consortia. Engage to Change, which is a group working program that we run 4 times a year, and Fixed Address, which is a case managed program. In each of these, I work with men who have chosen to use abusive, controlling, intimidating and violent behaviours. So essentially I'm just going to talk very briefly about what these programs are and what the aims and objectives are of them. Men's behaviour change programs are a space, they're a non-judgmental, respectful space that we can engage with men who have chosen those types of behaviours that have had an impact on their partners, their former partners and children, and sometimes further on with siblings and other family members. That's why the term DFV, or domestic and family violence, has been used more broadly over recent years to reflect that. We like to think of it as an invitation. The programs are an invitation for men to explore their attitudes and their beliefs, their worldviews that underpin their behaviours, the behaviours that they choose to use, which hurt and harm their families. It's also a space that we can raise their awareness as to the impacts of their choices upon the people in their lives. And like I say, across the region, the Mid-North Coast, we run the same programs, Engage to Change and Fix Address. There may be very small variations, but essentially we work from the same manual, but ultimately we're working from the same desire that women and children's safety is always at the forefront of everything that we do. What we do is we identify risk. I know that in your earlier discussions, you're talking about the 5 R's: the recognise, assess risk, respond, refer, and restore. I couldn't remember the 5. I've just got them written down here. So yeah, we do that as well. We identify the risk. We try to mitigate those risks by effectively sharing information with other organisations, partnering organisations. So we work very closely with New South Wales Community Corrections as one particular agency, as an example. And so once we identify, when we're working with men, as I say, in that compassionate, respectful space, we are looking to model the behaviours that we hope men take on. So we're having that space, we're opening that dialogue about what it is their choices have been, to really explore those attitudes that really have underpinned many of their choices. That's, for example, entitlement. How do you see your choices? Why do you use those choices? Again, not in a kind of accusatory way, but it's a curious discussion, and it's a way to grow empathy, really. It's a way of getting them to understand the true impact of those choices. Also, too, in the space, it's about dispelling excuses, really kind of busting those myths. I don't know if that's a great way of describing it, but kind of dispelling those ideas of they cling to the choices, the attitudes that underpin those choices, and hopefully help identify a pathway to safer preferred behaviours as both partners, co-parents, parents in that space. The programs are essentially for men who are ready to make changes and really take responsibility. As I say, we talk about accountability. As workers in this space, we can't hold men to account, but we can encourage accountability or invite them into that space through those discussions. I think whilst we're talking about how we do what we do, I think the use of language is really important. You might hear I'm talking about men who choose to use behaviour instead of saying perpetrators of violence. I know that there's not a lot of difference in that, but if we're talking about men who choose to use abusive, controlling behaviours, that opens up the space for change by simply referring to somebody as a perpetrator. That's an identity, and it can kind of limit that change opportunity, if you like. Whilst we're also talking about the use of language, we talk about victim survivors, not simply victims. Children, as well as women in this space, are victim survivors. And again, we talk a lot about location of responsibility. And again, this could be helpful for all of us in this sector, but it's really important that we locate that responsibility. You might have heard people saying things like a toxic relationship, it's a bad relationship. That's mutualising that kind of responsibility here. And that places some of that responsibility on the victim survivor or survivors. So again, we try to use this language about, okay, a man who has chosen to use that behaviour. How do we do it? As I say, we do our best to do that pro-social modelling, that modelling of respectful discussion, upholding dignity of the men that we work with, and also keeping women and children at the forefront of those discussions. It's always an invitation, whether it's in group work or in one-to-one, it's always an invitation to accountability and, as I say, that growth of empathy, and then holding that space for men to reflect and embed some of that information and really check in with where they're at. What you guys can do, other agencies, we're working together. I'm a big fan of integrative working. We can't all do these things together, on our own, in isolation. No agency can do everything. And as the theme of this is, it's everyone's business. DFE is everyone's business, and it truly is in our communities. We all have a part to play in this. What we would say, and I would absolutely encourage, if anybody in our region has questions about men's behaviour change programs, I would encourage, please get in contact. As you're probably gathering, I like a conversation. I'm really passionate about what we do here, and always pushing forward with the best way we can support our communities to become safer. But essentially, I work with men who choose to use abusive, controlling, violent behaviours to advocate for the best life for women and children, for their best safety. If you ever want anything to bounce any ideas, please do get in contact. Always happy for a yarn. Thanks.
Thank you so much to the previous presenters. Now we're moving on to another topic that I know lots of people are looking forward to hearing about some more. I'd like to introduce Mel Harrison from People with a Disability to talk about the impact of domestic and family violence on women with a disability. Thank you.
And it's over to me. Yeah, excellent. Cool. Hi, everyone. It's Mel Harrison here. I'm the Acting Director of Communications, Training and Media at People with Disability Australia. And I'm really interested in being here today because I feel it's a really important topic, what we're talking about today, but to also talk about it with the lens of looking at disability when it comes to domestic and family violence for people with disability, and primarily women who have disability. So at PWDA, for people that may not be aware of our organisation, we are a national disability rights-based organisation that looks at providing advocacy support for people that have disability, either in an individual level or through systemic level, or providing training or education around different issues that come up for people with disability and for people that may be supporting or assisting people with disability. Now, in terms of PWDA, for the past 4 years, we've had a program that's called the Building Access program, and that's working with domestic and family violence services across New South Wales that may be able to or may support women primarily or children that have disability that may experience domestic and family violence. Or if the service actually knows that there might be people in their area that may require support, but they realise that their service might be geared for accessibility due to disability issues. So this program, as I mentioned, has been going on for 4 years. Every year we work with 5 extra services across New South Wales. And when we're working with the services, we're looking at trying to ensure how do we make services more accessible for women and children with disability to be able to access. And we're, as an organisation, we're quite aware that often a lot of the issues around accessibility can't be changed because the service mightn't own the building, for example, so we can't structurally change the service. But there's a lot of things that can be changed. So, and it often can come down to as simple things as people's attitudes in working with people that have disability in itself. And the reason why we've come to having this program in the first place is that we understand that when it comes to disability, or when we come to domestic and family violence in itself, that the statistics are quite high out there for anybody, which is really not great in itself. But when we throw disability on top of that, the statistics are even higher around domestic and family violence. So, for example, as we've got up on the screen, you got 1 in 4 women that are without disability, or 1 in 5 men, or 1 in 15, men without disability will experience sexual violence since the age of 15. However, when it comes to women with disability, they're 40% more likely to experience domestic and family violence than their peers will experience. And sometimes that comes down to the fact that it is that people don't believe people when they have a disability and they come forward and they say that they've experienced violence. So they're not seen as reliable witnesses. It could be simply that the person that is perpetrating against them is the person that they depend on due to the fact that they have a disability, therefore they can't report it, for example. But the big issue is as well is that the statistics are so high for women with disability experiencing domestic and family violence, but the amount of services that are out there for women with disability to be able to access is very significantly low due to accessibility. And when I say accessibility, I'm not just referring to physical access, because even though that's a huge factor in the whole scheme of things, it's not just about physical access. It's also about the fact of whether a person that has a disability or a woman with disability is able to access a service and have their access needs met in terms of communication. So if that woman has a hearing impairment or is deaf, or if that woman is blind or has a vision impairment, or they have an intellectual disability or a cognitive impairment, are there staff available that can work with those women to ensure that they can get their needs met? So that's a huge issue that's out there. It's also around the attitudes that are out there for women with disability in being able to access services. So we always need to make sure that when we work with disability, to making sure that when we're working with somebody that has a disability, we're looking at the person as a person first. So the disability is always coming second. So we're treating that person as a person, and then whatever they need because they have a disability, looking at that, but not focusing on their disability just because of the sake of focusing on their disability. So more statistics up there stating that, people with disability are twice as likely to experience partner violence as well. And in New South Wales, 30.6% of women who experience personal violence 12 months prior to the survey were estimated to have a disability or a long-term health condition. So the statistics are quite high up there for people with disability. For anyone that's not aware of the UN Convention of the Rights of Persons with Disability, so Article number 16 under the UN Convention of the Rights of Persons with Disability, Australia ratified the UN Convention back in 2008, and one of the articles states that there is a commitment to protect persons with disabilities both within and outside the home from all forms of exploitation, violence and abuse. So as we were mentioning, the aim of the Building Access Project, and not just the Building Access Project within PWD, but within working in violence prevention across the whole of the organisation, is to increase accessibility for people with disability to access domestic and family violence services for women with disability, but also all people that have disability. And the ways that we do that is that we go to the services and we do a access audit or an access review on the services. And part of that review is looking at the physical access. So that is going through the whole service, whether it's a refuge, whether it's a health centre, whether it's a counselling service, etc. We look at the service in terms of the access, the physical access, and how things could change in a way that would be appropriate on a short term a medium-term and a long-term effect. We also look at procedural information. So what are the procedures that are in place to ensure that people with disability can access the service? We look at attitudinal barriers. So that's looking at how does all the staff respond or react to people that have disability if they were to access the service, or how they would respond or react to people with disability out in the community to ensure that people with disability would feel comfortable in coming to the service. And then we also look at the information. So we're looking at the information that is presented, because often information needs to be translated in a way that's more accessible. So that could be done through an easy read format. So that's going through services that can translate documents or brochures into a way that somebody that might have an intellectual disability or a cognitive impairment can read and can translate and can understand. Or it might be about translating the information into text through a video where you have somebody that's providing Auslan and you're doing the open captions, for example, or you do the audio descriptions for the person that might have the vision impairment. Once we do those reviews, our team puts a report together, and that report really highlights what some of the issues are. And then from that, training is provided. So providing disability awareness training and NDIS and advocacy training. So the disability awareness training is very much about looking at how we as individuals can work with people that have disability. So it's not looking at all the different types of disability as itself, but looking at what are some of the things we can do as individuals or as services to try and eliminate some of the barriers that might be in place for a person that has a disability. Because I think that's something that we should all do all the time, because I don't think it's a one person's job. I don't think it's a one organisation job. I really think it's everybody should play a part in that to try and break down some of those barriers that might be out there for people with disability. Because from my experience of working in the sector for many, many years, is often people with disability are experiencing violence, and it's reported, for example, but it's not seen or taken seriously in the context as it being a crime. So it's been seen as a house issue, a code of conduct issue, and dealt with within the house, as opposed to it being treated with as a crime and being named for what it actually is. If there's any questions, let me know. So some of the practical recommendations that are out there often for people in the domestic and family violence services. So stage 1, which is minor and straightforward changes. So these are the things that often people can do quite quickly and quite easily and without too much of a financial cost. It's things around like rearranging furniture to enable for wheelchair access. So for people that haven't met me before, I use a wheelchair myself, and I know very well that I'll often travel prior to COVID times, of course, but I was constantly travelling, and I would ring places up and ask for wheelchair access, etc., to stay at a place. And often people don't understand what wheelchair access means, because often people think if it's flat to get into a building, then it's wheelchair accessible. But that's actually not what wheelchair access means, because it's good if you can get into a building, but once you're in the building, can you get around? So it's making sure that you're looking at the bigger picture, or if the building is flat to get into, is that person able to get to that building in the first place? So, for example, are they able to drive and park outside? Or are they able to get public transport to get to that building, to be able to get into that building in the first place? Or once they're in the building, are they able to access a bathroom to be able to utilise that? Or are they able to go to the kitchen and get a glass of water or make a cup of tea or a cup of coffee for themselves, etc. So wheelchair access is quite big, and it's not just about there not being a step to get into a building. So, and it's very independent as well to a particular person. So it's always important to find out from a person as well. So making electronic information available. So that's great for people that have sensory disability. So for a person that has a hearing impairment, who has a vision impairment, etc. So having electronic formats is really useful, but it's really also really useful to have somebody focus test it. So that person that would require the use of it, them focus testing it, because if we don't use it ourselves, we don't always see the problems that might be there for the person that actually needs to use it. So that's always really important to remember as well. Training staff, again, in disability awareness, planning inclusive events and making sure they are accessible. So when we plan events and we want to make sure that they're accessible, getting people involved that could give advice and could give some sort of awareness around whether it is accessible and it is inclusive, and not planning events that are just for people with disability, because then that's still segregating people that have disability as well. Ensuring client evaluation feedback forms are available in different accessible formats. Again, that's a bit to the same as the previous point. So it's about making sure that any forms, our websites, etc., are as accessible as we can make them to enable a person with a disability to be able to access it, to make an informed choice about whether they're going to access your service or whether they would feel comfortable in coming forward and speaking to your service. And ensuring that policies are inclusive as well. So we're stage 2, where the modifications that need more planning. So this could be around things like installing tactile ground surfaces. So for people that don't know, tactile ground surfaces are those little round silver dots that are on the floor, or the long silver rectangle squares that are on the floor, and that's for people that have vision impairment, to give them hazard warnings. So for them to know whether they've got to stop, they've got to turn, or whether there's danger ahead. They're very, very useful. So things even as useful as if you've got fire stairs, ensuring that within your fire stairs at the end of each step, you've got the contrast strip as well, because if you've got someone that has low vision using those stairs, then they'll be able to tell when the next step is, and it makes it less dangerous for them to access it. Ensuring that light switches and power points are at an appropriate height. So that's really important, because we can probably all sit back and imagine that if we're in a place and we need to ask people to turn light switches on for us, or we need to ask people to put a charger into the power point so we can charge our phone, for example, so very basic tasks that we would do every day ourselves, how much that can disempower us as people. So ensuring doing things like that can actually empower people with disability to feel as independent as they possibly can. Ensuring that the website adheres to disability standards. So again, these are medium-term modifications, and they do take time, they do take planning, and they do take money. But if we have the ability to do it, so we've got the resources and the funding and the planning to do it, it's really useful to do. Developing easy English brochures, making recruitment policies and procedures inclusive and accessible. Do we have people that we work with that have a disability? Are people on our board with any disability that can shed any light or can be part of that process, etc.? So ensuring that we're being as inclusive as possible within our recruitment processes, building networks with different disability providers is really useful, because one of the things around domestic family violence and disability is that both services or both areas are the experts of those areas. So domestic and family violence is the expert of that area. Disability is the expert of that area. So working together is very useful when coming together. So building relationships with other services about it, because often what is known out there or what is spoken about or what is heard is that people don't believe that people with disability are experiencing domestic and family violence. And often when we think about the domestic and family violence, a lot of people out in the community still view domestic and family violence as being just within the home, like as in direct partner, your direct partner that you live with, or your direct family, etc., where it's a lot broader than that in the disability sector. So because people are living in boarding houses, they're living in group homes, they're living in institutions, they're living in, they're going to day programs, etc. So that violence goes across it all. So it's a lot broader, but often in the community, it's not seen as that. So being able to work together with services to break down some of those barriers is really useful. And the bigger stage as being stage 3, which is the significant changes, which will take a lot longer in time, is ensuring physical access to building abides by livable housing standards. So, and that is if we're going to open up a service, try to get the service to be accessible prior to starting the service would be useful. For example, creating introductory DVD for clients of the service, or seeing whether services can work together to create that DVD together. Develop and implement disability inclusion action plans, which part of the program we're building access when we're working with the 20 services. After we do the review, we provide them with the report, and from that, the service and PWDA developing a disability inclusion action plan to give them a guidance of how they can work towards short-term, medium-term and long-term goals of trying to become more accessible for people that have disability, and ensuring that women with disability are represented on a service board and or management committee level, because it's a good way to ensure that women with disability have a voice. And when we show that women with disability have a voice, people start to speak up. Any questions?
Thank you very much, Mel. If there's questions in the chat box, we'll let you know what they are, and we'll let you have a chance to respond. Thank you so much, though, Mel. Fantastic presentation. Now I'd like to hand over to Vigita and Emma. Emma's from Anglicare, the 3 E's to Freedom program, and Vigita's from Settlement Services International, manager of the settlement manager settlement programs. Welcome you to the podium.
Thank you. So good to be here. Thanks, Taryn, again. So Settlement Services International is funded by Department of Home Affairs to deliver the Humanitarian Settlement Program. For short, it's called HSP. And we settle clients in Coffs Harbour and the surrounds. The Humanitarian Settlement Program assists clients to build the skills and knowledge they need to become self-reliant and active members in the community. Case management is a crucial part of the Humanitarian Settlement Program undergoing its delivery to ensure the clients are provided with the support they need in a timely, coordinated manner. On a needs basis, we service the clients in terms of their settlement journey. We assist them for their school enrollments, for medical appointments. We also let them assist in a orientation program where there's 3 application stages, and we cover topics such as settlement services, housing, managing their money, Australian law, education, employment, feeling safe at home, and transport. Now, with the COVID restrictions, it was quite difficult managing our clients as we were all working from home, but we had come up with some creative ideas as to how we will be assisting some clients. In the Coffs Harbour area, we have been welcoming our new families and we celebrate a cultural diversified population. For the last 12 months, we have settled clients from Syria, Iraq, and they are mainly the Yazidi cohort. They are Christian in religion, and they're also clients from Ethiopia, Burma, Eritrea, and the Dominican Republic of Congo. And so there's a wide variety of clients we settle in Coffs Harbour, and they have their own different issues, and they're quite lovely people to work with as well. So since we started working from home and due to the COVID restrictions, issues of domestic violence have emerged due to the restrictions, and some of our clients have required intensive support through these issues, and our lovely case managers have been creatively working through this process for them. So part of our program, we also have the specialised intensive service. This program is embedded in our program to provide clients with the extra support. So under this specialised intensive support, we will have clients under Tier 3. Anybody from the community can refer this client if they are in the country for 5 years and they have arrived under the special humanitarian visa. So under this program, anybody can refer to a client who is facing domestic violence, homelessness, mental issues, or any disability. And anybody can do the referral as well. So it just goes through our Department of Humanitarian website. If anybody's interested in that, I can email the details for a referral. So today, as the focus is on domestic violence, I would like to now share a case study of how women from the CALD community face. As you all know, they come with lots of torture and trauma. Some of our Yazidi clients are survivors of the ISIS issues, so it's a really big change and culture shock when they first come to Australia. So now I'll begin my case study. We have a young family of 4 that arrived recently to Coffs Harbour from Iraq. Sarah is a 20-year-old woman from Iraq and Tom is 22 years old. They both have 2 active boys, aged 2 and 3. They both got married at the age of 16 and 17 years of age. And after 6 months of being married, Sarah felt pregnant. They arrived in Australia late November 2019. Sarah had her mother's side of the family here in Coffs Harbour, and Tom had her aunt and cousins here as well. Due to the COVID restrictions, all client meetings have to occur over the phone, which was less confronting and informative than having face-to-face meetings. But when troubling reports came to light, our case managers did creative thinking, where we took the women, to the park to have a great chat with her so that she could open up and tell us what's going on in her household. Because we were working from home, SSI tried to do well-being checks with the help of an interpreter to speak to the clients to see how it was like for them due to these restrictions. Some of the feedback we got was that there was too much information being shared, so they were not able to voice out of all the things over the phone. So when we took this client to the park, she was able to share us all the things that has been happening. First of all, she mentioned that she had been going through a physical abuse, and that had produced on several occasions, but she didn't want to report it, as it was a taboo in their culture, in the community. So it was reported that she had treated on different occasions of the violent behaviour back in Iraq and also after arrival in Australia. So after we were told about all this, one of our support workers received a message on her phone which contained a recorded message of Sarah screaming at her husband to stop hurting her. We arranged immediately for Sarah to come to our office and meet with the police, which she reluctantly agreed to do. At this time, the case manager made a report to FACS. Tom was also issued with an AVO for his violent and controlling behaviour. The family were also then given extra support under our Tier 3 program to get the extra specialised service. There had been lots of abuse in the family, but it hadn't come to our light. There was also financial abuse in the family because the husband was not giving the wife the bank card to go shopping or do anything. He was taking care of all the financials. The case managers informed the client that it is illegal in Australia for her husband to not give her bank card. The case manager suggested to the client to close her current bank account and open the new one and advised her to keep the PIN code as a secret. So it took us a lot of time and energy and doing a lot of critical thinking to work with this case, and again with the COVID restrictions. So Tom also had threatened to take a video of Sarah smacking one of her children to the police, telling her that she will lose her kids and he will get full custody. The case manager sat down with Tom shortly after he was issued with an AVO and went through it in detail with him with an interpreter. And he is now aware that any threatening, controlling or violent behaviour towards Sarah could result in criminal and jail sentence. We also referred him to various organisations for support. Face-to-face education support was given. Topics covering Australian law, physical abuse, financial abuse was provided to the couple by Police New South Wales DV team and our HSP orientation team was provided to the couple on numerous occasions. So we thought by having this face-to-face information session with the client one-on-one was very helpful, and Tom was able to understand his legal obligations having arrived in Australia. We had also referred the family to parenting program with Uniting Care. As young parents, they were not able to understand how to manage their children as they were very active kids, and it had taken a lot of time and energy. But by referring them to these different services, it helped them a lot. The family were also reported to FACS on 2 occasions where the neighbours were reported that the children were unattended by parents. They were also referred to STARTS for counselling support. This is currently being conducted face-to-face because of the issues with the families. We had requested face-to-face support for them. They were also referred to couples counselling through Interaid, but they both had declined. And again, for our clients who come from CALD community, sometimes they feel that if we refer them to a lot of services, they get a lot of information and they get confused. But we have to be very proactive to let them know this is something very good for you for here in Australia. And then at the last check-in phone call, both Sarah and Tom said that the relationship was going very good. There wasn't any violence in the family. Tom had also been to 3 face-to-face meetings with the police throughout the period mentioned above, and we believe that they're doing really well at the moment, and the case manager is still trying to do a wellness check-in with them to just have a great success story for them. And yeah, we think that with the support of all these extra service providers has helped this family become really well, and also for the man to be aware of his rights of coming to Australia and not reflecting of how things were back in Iraq or any other countries that they come from. So yeah, it's I think very important for them to get educated, and through our program we try to reiterate the information about DV. Thank you.
Thanks, Vigita.
Sorry, I'll forward on to Emma now.
Thanks, Vigita.
I'd like to begin by just acknowledging the traditional custodians on the land in which I live and work, and that's the Gumbaynggirr Nation, and where we are today, the Dunghutti people. I pay my respects to elders past, present and future, for they hold the memories, the traditions and the cultures and the hopes of Aboriginal Australia. Thank you for joining us today and opening up the conversation about family and domestic violence. I work with refugee and migrant women in a program called the 3 E's to Freedom, based at Anglicare North Coast and Coffs Harbour. I support women to navigate pathways to education, employment and empowerment. So domestic and family violence is not my core work. I'm not a domestic and family violence specialist, but as a frontline worker working with women, I can often be the first point of contact that someone talks to if they are experiencing a difficult relationship. And to tell you the truth, at times I have felt out of my depth. But I feel that I've had professional development and I've been mentored, and obviously working alongside the specialists in Coffs Harbour has helped me to feel more confident and step into this space. As frontline workers, we build trusting relationships, and in turn this means that women and children and men may disclose to you. And in this space, I feel that we need to be prepared to have conversations. I find that called clients are more inclined to disclose to a trusted person. And for the called community, this is often a close friend or a support service worker, such as myself. And on occasion, it's someone outside their cultural group. They do this in preference to stepping into a DV service. So it's important that we know what to say and we know what to do in these situations. It's critical to follow our clients' lead, as they are often very well equipped and very knowledgeable about their own situations and how to keep safe. I find some people just want to talk, and that's okay, but of course, safety is paramount. If I know about a situation, then I feel it's up to me to make that extra phone call to stand beside my client and make sure that they're safe, and also knowing that they can talk to me at any time. As many of my clients were not educated in their first language and married very young, some only know very basic conversational English with very little ability to read English, then being able to talk and to understand each other is critical. Having a budget to access interpreters is essential. I feel that our DV services do this very well. Making sure you also have the right interpreter is crucial. Making sure the dialect matches. I've had many conversations where I realise that no one has understood each other 15 minutes into a conversation. So it's important that you can generate a conversation safely and that these people can understand each other in a safe space. So the question is, why isn't the call community making reports and stepping into DV services? In my experience, it's about fear, it's about shame, and it's about taboos associated with DV for the call community. There's fear of reporting due to being isolated from community, fear of being deported, fear of losing children, pressures from family overseas impacting family here, fear of police and authorities based on their prior experience in various countries, fear of visas being revoked, fear of losing partners and being alone in a foreign country, and probably the biggest fear of all, going against religion or cultural beliefs. This group of people are so very vulnerable. Called clients are not voicing their concerns, and the reasons that these people are not talking is total and utter fear. So if my clients don't want to talk to a DV specialist and they're inclined to talk to me, that's important that frontline workers know what to do and say. It's a verbal conversation. Me handing a piece of paper full of phone numbers and names of services is doing my client a disservice. It's important we can understand each other and together come up with a game plan of safety. I say things like, are you safe to go home? What do you do if you don't feel safe? Can you stay at a friend's house? Would you like me to show you how to call 000? I find a lot of women I work with can already identify their partner's pattern of behaviour, and they already know what to do. They've already got a safety plan. But to say it out loud takes their understanding of their situation to the next level, recognising that they are living in a domestic violent relationship. I work with the CALL community and I love this space and I love working with the women I do. However, it can be a challenging landscape to navigate, especially around concerns of family safety. Working in this space has meant I've had lots of conversations, much like Vagita in her service, about what is family and domestic violence. I've been confronted by women recognising for the first time that they are living in a DV relationship. But not only that every relationship they've ever known, their parents, their grandparents, their aunties, their uncles, have all been family and domestic violent relationships. This challenges everything that they know. It challenges their culture and it challenges their family values. Imagine learning everything you know about relationships is against Australian law. To label it, to name it, and to talk out loud about it is for some women truly heartbreaking. Working with the CALL community requires the utmost respect. These people are trying to navigate new lives and understand Australian law, which means that they have to reassess their relationship, educate their partners. Easier said than done. There's no magic wand, if only there was. So it makes sense to me that the DV service Warina in Coffs Harbour revealed to me that they only really connect with the CALL community when things are at the pointy end of family and domestic violence. So this means that an incident has occurred or police have been involved. This illustrates the need for service collaboration and to come up with innovative ways to educate the CALL community and work more effectively in the area of men's behaviour for change programs, early intervention and better yet, prevention. Anglicare North Coast, in partnership with Warina in Coffs Harbour and Southern Cross University, have commenced a collaborative research project to give us insight into how better connect with men and women in CALL communities. The research is titled From the Voices of Called Women Towards Achieving Family, Safety and Freedom. Dr. Mandy Hughes, who is unable to be here today, from Southern Cross University, has conducted a literature review that investigates DV issues with CALL communities in regional Australia. She's identified and is reviewing men's behaviour change programs and has recently conducted research with 10 participants from both multicultural backgrounds and key service informants. Dr. Mandy Hughes has just completed the interviews and has provided me with a small snapshot of the research that's starting to emerge. Key stresses such as unemployment, changing gender roles, alcohol, gambling and lack of family were identified as contributing factors to DV. Those experiencing violence will only talk to those that they trust, usually close friends or recommended support services. CALL community don't want to talk about violence beyond their networks as it will bring shame to their family. Called men don't know how to be men in Australia, and one woman quoted in her interview, "They don't know the rules, they don't know how to be a man in Australia." A men's group would be great and beneficial to run in cultural groups. These are just some of the themes starting to emerge from this valuable research. And if you're interested in the final paper, which should be completed in the next few months, please let me know. My key takeaways from today: follow your client's lead. Ask your client what they want to do. Don't tell them what to do. Continue to participate in professional development. Have your verbal plan ready to go and a conversation ready to have. Know your family and domestic violence specialist. Take them out for coffee or tea. Buy them cake. Know their names. Walk into their service. Know them by name. Know them by position. And know their 24-hour emergency line. Be that person who follows up and checks in. I know everyone's busy, but these people are vulnerable and they need our help. Be that person who checks in, but also look after yourselves. We can't help others unless we're in a position to do so, which means self-care, making time to debrief, reaching out to the specialists, ensuring that clinical supervision is part of your work. Many thanks for the opportunity to talk about working with the CALL community. I feel it's a real privilege to be in this space, and thank you for organising today. Thanks.
Thank you so much to Emma and Vagita for coming along from Coffs Harbour today to Kempsey to talk about their experiences. And I would reiterate, yes, I think that more coffee is always the way to solve any problem. Okay, so now I'd like to introduce Eloise from ACON. Eloise is the program coordinator of sexual, domestic and family violence. And we're going to stream her all the way from Sydney right now. Thank you.
Beautiful. Thanks so much, Taryn, for that lovely introduction. It's wonderful to be here, albeit virtually. And this is my first time streaming in this way, so let me know if you can't hear me or anything like that, and hopefully we'll be able to fix that up. Hopefully you're seeing the slides that I have on the screen at the moment now as well. But thank you so much for having me, as I said. So I'm here today to talk about sexual, domestic and family violence and LGBTQ relationships, and really hoping just to give you, I suppose, like a bit of an overview around maybe some of the considerations and knowledge that I think is really helpful to have. Before I get started, I just want to take a moment to acknowledge the traditional lands that we're all meeting on today. So I'm Gadigal land of the Eora Nation in Sydney, and pay my respect to elders past, present and emerging, as well as any Aboriginal and Torres Strait Islander people who are here virtually or otherwise with us today. And I've only got 20 minutes, so I'm sorry if I'm seeming like I'm running through this a little quickly. Please do bear with me. So I just sort of set the scene, I suppose. I wanted to talk a little bit about LGBTQ communities. And, you know, research, I suppose, is limited around even how many of us are there, because there's actually a lack of sexuality and gender indicators on national research studies in Australia, including the census. But research shows that we make up approximately about 11% of the population, and actually those numbers are growing as well. And I think one of the reasons I really like to highlight this data is a chance for us to think about how many of your clients might be part of the community, might be LGBTQ. And, you know, if it's not around 1 in 10, then perhaps that's not quite representative, and thinking around what perhaps we could do to make our services more inclusive and welcoming. I also wanted to share some statistics about LGBTQ people before I move on to talking about intimate partner and family violence. So research shows that 87% of us have been affected by at least one form of discrimination, but I would probably quibble maybe with that exact statistic, because 100% of the LGBTQ people that I know have been affected by at least one form of discrimination. You know, we can see really high prevalence of physical violence, public comments, you know, mean and hurtful comments, but also really wanting to draw your attention to those last two statistics on the screen, that 44% of LGBTQ community members reported hiding their gender or sexuality usually or occasionally, and that 34% hide their sexuality or gender when accessing services. So I think this is another thing to keep in mind, again, looking at, you know, how can we make our services welcoming environments where people don't feel that they have to hide their sexuality and gender, but also being aware that we might be working with LGBTQ people without actually knowing it at the moment because of statistics like this. When we look specifically at the experiences of young people, we can also see that 44% of young people have reported verbal abuse, 16% physical assault, and for 74% that happened at school. And 24% of young people in this one study called Writing Themselves In had actually experienced abuse at home. And I have a couple of quotes on the screen from that research. So one person said, you know, at one point in time they suspected I was gay. I was locked into a room by my parents and brother, much like an interrogation, physically and mentally abused for a few hours, and released after I kept saying I will kill myself. Although their reply was either kill yourself or we will kill you. And that was a 15-year-old. And you know, those words are obviously incredibly distressing, but I think it's important to highlight those stories and acknowledge that these stories are happening within families. It is affecting young people. When we look at homelessness as well, we know that LGBT people are at least twice as likely as heterosexual people to experience homelessness. Bisexual people are much more likely to have at least 5 repeated experiences of homelessness than heterosexual respondents in one study. And in New South Wales, of the 20,000 plus young people who are homeless, it's been estimated that 1 in 4 is gay or lesbian. And we also know that gender questioning young people are more likely than their LGBT peers to experience homelessness. And 17.8% of trans young people who took part in the Trans Pathways research in 2017 had been homeless. 38.9% had access to crisis accommodation. And of those, 43% felt that their gender identity hadn't been respected when they accessed that service. So I suppose I want to highlight those points to kind of couch some of our discussion around intimate partner and family violence in this understanding of systematic discrimination and, the impacts of trauma and minority stress that might be affecting the clients that we're seeing, because I think that really impacts, perhaps the risk assessments that we might do with young people, the questions that we might ask. Really important to have that knowledge sort of in the back of our minds when we do that. When we think about sexual, domestic and family violence in our communities, when we look at prevalence, we have limited but growing data that indicates that LGBTQ people are at least as likely as non-LGBTQ women to be victims of intimate partner violence. And for trans people, that can be anywhere between 60 and 80% of people who have actually experienced domestic and family violence. I just wanted to share on the screen a little bit of data from a really recently released survey, Private Lives 3, which is a national survey. It's, I think, the largest in Australia. And you can access that report to view a breakdown of experiences of intimate partner violence and family violence by both gender and sexuality to really show those differences within the LGBTQ communities. But I wanted to share this research in particular just to highlight those really significantly high rates of verbal abuse, physical abuse, emotional abuse and other forms of abuse as well. And LGBTQ-related abuse as well, which I'll talk about a little bit more. And when we look at support and experiences of seeking support, we know that many LGBTQ people do not disclose their experiences of violence or seek support from services. So we have 2 studies up here. So calling it what it really is a New South Wales-based study that looked at the experiences of LGBTIQ people of all genders, and Sorting It Out looked at the experiences and attitudes specifically of GBQ men. So we saw, fairly high, high-ish rates of seeking support from friends compared to other support services, but really quite low rates of reporting to police or to counsellors, even to family, to doctors and hospitals. So we do have quite low rates of reporting, and those that do report are sometimes less likely to actually be able to access support that meets their needs. And when we look at the low rates of reporting for our communities, and we can look at the reasons for not reporting, we know that the reporting rates for cisgender heterosexual women are also really low, but the reasons can be a little bit different. So on the left of the screen, you'll see the top 3 reasons given by cisgender heterosexual women for not reporting, and I'm imagining they'll probably, perhaps be familiar to some of you. It's around shame and embarrassment, fear of revenge or escalating of violence from the abuser, or belief that the incident was trivial. When we look at the reasons given by LGBTQ people for not reporting, we have, a fear of not being taken seriously, a higher threshold to abuse, or inability to recognise domestic and family violence because of that, life history-based discrimination that we just spoke about. And also a fear of gender and sexuality-based discrimination from that service provider, as well as a fear of being outed. So in a way, people really have to get through, LGBTQ people really have to get through all of these reasons, which aren't even really to do with the violence they've experienced, before they can even, tackle these other reasons that non-LGBTQ women also experience. So there are, a number of barriers towards reporting abuse. When we look as well about if domestic and family violence is different in LGBTQ relationships compared to non-LGBTQ relationships, we would say that as with all violence, and as I'm sure you've been speaking about today, violence really is rooted in power and control, and that's kind of that basis there. But we can look at some different forms of violence that our communities experience, and I would kind of call this, roughly identity-based abuse is kind of a catch-all term that I would use around that. So that's, things like someone's gender or sexuality being used against them. It could be experiencing threats to out their sexuality, gender, intersex status or HIV status. It could be cutting them off from community events, pressuring them to conform to sex or gender norms, using offensive pronouns such as it to refer to their partner's gender, or even kind of weaponizing myths around domestic and family violence. So saying, no one's going to believe you if you tell them what's happening, or gaslighting them by saying, this is how all gay people act, or this is just what you should expect. So I think it's really helpful to have a little bit of knowledge about some of those different forms of violence that people in our communities can be experiencing, and just be aware of those as we are sort of doing risk assessments or hearing about other people's experiences. So with all of that knowledge, I suppose putting it into action is really around inclusive practice. And I just wanted to really briefly touch, because I know we don't have too much time, on, thinking about how your service can be inclusive, and that includes thinking about visible inclusivity. There's one thing that we sort of like to say at ACON, which is, LGBTQ people are really used to not being perhaps welcomed into services or assuming that things aren't for them. And so we sort of say, if you don't write us in, we'll write ourselves out. So, really important to be really specific and clear and active around welcoming LGBTQ people and letting people know that, your service is a safe one to access. And that can be as simple as, a poster on the wall, a little rainbow sticker. It's not everything that we have to do, but it really is that visible signifier for people that it's safe. Also considering including your service on service finders. So really thinking about how would an LGBTQ person know if they're welcome to my service? What would they be able to look at? Is there information on my website? Could they see that by walking into the service? What would that experience be like for them? How inclusive are my forms? Would someone look at my form and feel like, that they can write the answers that correspond kind of with their identity? So, language and pronouns are also really important. So thinking about the questions that we ask people and whether there are assumptions tied up in them, things like, are you married? Are you male or female? Those come with assumptions, so thinking about rephrasing, for example, what's your partner's identity? What's your name? And if you need to know their legal name, perhaps asking that separately, asking questions that are quite open, like who's the significant people in your life, to really get a sense of, what you might need to know for a risk assessment or for referrals or safety planning. And when we talk about pronouns as well, we all have pronouns, so they can include, he, him, she, her, they, them. And the pronouns we use often refer to a person's gender, but we can't always tell what pronouns a person might use or what their gender is just from looking at them. So using the right pronoun for a person is a really easy and simple way of showing respect. So, it's about listening to how a person describes themselves, thinking about perhaps offering your own pronouns and how and when you might ask the other person's pronouns, thinking as well about their safety if they were to kind of answer you there as well. And, if you do get it wrong, apologising and correcting yourself and then moving on, and then going home and maybe practising those pronouns. I think, I talk to a lot of service providers that are a little bit nervous around things like pronoun use. They're not sure how to do it. They're quite nervous. But I would say I think that attitude of openness and that active commitment to inclusion is really important. And, those intentions matter, but so do your practice and your chance to, research and learn and develop your own knowledge around this as well. And also thinking ahead of time about where you might refer people that might be accessing your services. And I've included on the screen here, for anyone that doesn't already have them, Annabelle's details. So Annabelle is ACON's Health Promotion Officer for the Coffs Harbour area, works Monday and Tuesday, and is really happy to be contacted with any questions that you might have. ACON are a statewide service, so Annabelle can absolutely help you link in or provide support and information to mainstream services as well. And I'd also encourage you to contact Say It Out Loud. Visit sayitoutloud.org.au, which is ACON's website that's all about healthy relationships, intimate partner violence and family violence as well. And it includes information for community, people who are experiencing or using violence, and also for professionals. And we'll be updating that soon with a service finder as well, where you can even import your own service. So I know I've been talking probably a little quickly and go through a lot of information in kind of one go, but does anyone have any questions that they'd like to ask? I can't see the chat at the moment, but if anyone's able to share any questions that'll come up with me, that would be amazing. And thanks so much.
Thank you, Eloise. We're just checking to see if we have any questions. What we'll do, Eloise, we'll forward them on to you if that's okay, and then get the answers all the way out to the rest of the group. Thank you for that great presentation. Okay, now I'm going to introduce...
Thanks so much, everyone.
I'm going to introduce Senior Constable for Age Crime Prevention, Ruth Hanley, to talk about elder abuse.
Thank you. As you've been told, my name is Senior Constable Ruth Handley and I'm the Aged Crime Prevention Officer for the Mid-North Coast. The Aged Crime Prevention Officer is a new position for the New South Wales Police, and it's come about due to the New South Wales Police and Government making a commitment to dedicate resources to manage specific needs of vulnerable communities. So the role of the Aged Crime Prevention Officer is to prevent, disrupt and respond to the exploitation, abuse and neglect of vulnerable people in the ageing, disability and homelessness sector. The new role commenced in July 2019 with 6 positions across the state. There are now 12 ACPOs, 3 metro and 9 regional. We're lucky in the North region to now have 6 positions, 6 of those 12 positions, and that the plan over the next 3 years is for each police area command or police district will have their own aged crime prevention officer. As was indicated, I am the ACPO, or Aged Crime Prevention Officer for the Mid-North Coast Police District, and I work out of Port Macquarie. The Mid-North Coast Police District covers from Laurieton in the south to sort of Nambucca, Maxwell in the north, and then west to the Ranges. At a glance, 1 in 20 older people experience abuse every year. In 2017-2018, 528 incidents of elder abuse were reported to New South Wales Police. 1,854 were reported to the Elder Abuse Helpline and Resources Unit in 2016-17. As you all know, we are an ageing population. The average age for the Mid-North Coast is 50, where the state average is 38. 28% of the Mid-North Coast population is over the age of 65, so that's more than a quarter of our population in that over 65 bracket that makes them vulnerable. What is elder abuse? Elder abuse can be defined as acts or lack of action within any relationship that causes harm or distress to an older person where there is an expectation of trust. What it looks like. Elder abuse can be physical, psychological, emotional, sexual and financial abuse. It can be the result of intentional or unintentional neglect. The abuse happens at the hands of a trusted person and is mostly committed within a domestic relationship. What elder abuse is not. It is not age discrimination or an estranged relationship with a relative. It's not a crime that can be committed by a stranger. It does not involve self-neglect or self-mistreatment. Older people have the right to be treated with dignity and respect, to make their own decisions and choices, to live in a safe environment, to access the protections available to other adults in the community. As I said, there are 5 different types of abuse, being neglect, physical abuse, sexual abuse, psychological abuse and financial abuse. We're going to have a closer look at those different forms of abuse. So neglect is the failure of a carer or responsible person to provide or allow others to provide the necessities of life to an older person. These include food, shelter, clothing, medical or dental care. Some of the indicators of neglect, obviously dehydration, poor skin integrity, malnutrition, inappropriate clothing for the weather, poor hygiene, unkempt appearance, either under or over medicated, unattended medical or dental needs. They've got exposure to danger or lack of supervision. They might be found wandering. They might have absence of required aids, including hearing aids, dental aids, or they may have an overly attentive carer in the company of others. Physical abuse. The infliction of physical pain or injury or physical coercion includes hitting, slapping, punching, burning, tying an older person to a chair or bed, locking an older person in a room, overuse or misuse of medications. Some of the indicators for physical abuse include bruises, lacerations to various areas, abrasions and scratches, burns, sprains, dislocations, hair loss, missing teeth, eye injuries, pressure sores through the use of physical restraint. Then we have sexual abuse, which is a broad term used to describe a range of sexual acts where the victim's consent has not been obtained or where consent has been obtained through coercion. Some of the indicators for sexual abuse may be trauma around the genitals, rectum or mouth, injury to the face, neck, chest, abdomen, thighs or buttocks, presence of sexually transmitted infections, human bite marks, anxiety around the perpetrator, or other psychological symptoms. Then we have psychological abuse. This is one that is very hard for police to prove. but it is the infliction of mental stress involving actions and threats that cause fear of violence, isolation, deprivation and feelings of shame and powerlessness. Example, treating an older person as if they are a child, or engaging in emotional blackmail or preventing access to services. Some of the indicators of psychological abuse may include depression, demoralisation, feelings of helplessness, disrupted appetite or poor sleeping patterns, tearfulness, excessive fear, confusion, agitation, resignation or unexplained paranoia. Financial abuse. It's the illegal or improper use of an older person's property or finances, misuse of power of attorney or forcing an older person to change their will, taking control of a person's finances against their wishes and denying them access to their own money. Some of the indicators of financial abuse are unexplained or sudden inability to pay bills, significant withdrawals from their accounts, drastic changes to wills, unexplained disappearance of possessions, lack of funds for food or clothing, or a disparity between living conditions and money, or a recent addition of a signatory to a bank account. We have some criminal offences. Although there is no specific criminal offence in New South Wales that deals with financial exploitation of an elderly person through a power of attorney or otherwise, although other states have now introduced legislation specifically in relation to the misuse of power of attorneys. Financial abuse and exploitation can be prosecuted in New South Wales through a variety of offences. If there is a recognised domestic relationship between the offender and the older person, these offences can be prosecuted as domestic violence offences, and that's very important. So we'll just have a quick look at some of the offences that we can proceed against people that commit financial abuse. They might be charged with fraud under Section 192E of the Crimes Act. It can be proven that if there has been an intentional misuse of the older person's funds for their own benefit, this is in direct conflict with their duties as fiduciaries, a legal relationship of trust, and where money has been accessed by the offender with an intention beyond the scope or not justified by the power of attorney document. So we can proceed with a fraud charge in those instances. Another charge that we could use is larceny under Section 117 of the Crimes Act if we had the particular proofs required for that offence. Intimidation. This is to do in particular in relation to those psychological abuse and where they use psychological abuse for financial advantage. So it may constitute intimidation, particularly if there is evidence of the offender pressuring, threatening or coercing the person to give them money or other assets, or to cause that person to be intimidated or fearful. Once again, if there is a domestic relationship, including a person who is a paid carer between the older person and the offence is recognised as a domestic violence offence, and an application must be made for an apprehended violence order. These offences would be dealt with appropriately in court system and recognised as domestic violence offences and would attract heavier, harsher penalties in the court. Compensation. There is no remedy in New South Wales under the Power of Attorney Act for the victim to seek compensation or damages from an offender where assets have been misappropriated. So that's why it's very important for police to seek compensation if we proceed with criminal charges. In relation to power of attorney, an application can be made to revoke that power of attorney via family, the older person themselves, their family or friends, or anyone acting in the best interest of the older person. They should be advised to seek legal advice and, if need be, refer them to the New South Wales Ageing and Disability Abuse Hotline or the Guardianship Division of NCAT. Another offence that is available for police to proceed with is the offence of neglect under Section 44 of the Crimes Act. If a person fails to provide the necessities of life to someone who is in their care due to their age, illness or other impairment. This is underused, this offence, and we're trying to promote it and trying to encourage education within the community so that they realise that there is, if they are performing a carer's role, that they have a responsibility to provide those necessities of life to the person. So as it says here, to establish an offence We have to prove beyond reasonable doubt that the defendant had a legal duty to provide the victim with the necessities of life, and the defendant intentionally or recklessly neglected to provide the necessities of life to the victim, and the failure caused a danger of death or serious injury, or the likelihood of serious injury to the victim without reasonable excuse. So let's look at domestic violence and abuse of older people. Domestic violence is a range of abusive behaviours to gain and maintain control. It can occur between family members, between people living in the same household without the need for the relationship to be intimate, and in relationships involving paid and unpaid care and dependency. This in particular relates to aged care facilities where the staff actually are deemed to have a domestic relationship with the resident. So in the case of older people, family violence may have been occurring for many years, may be a recent development due to escalating emotional abuse and or the onset of mental health or psychological problems, or dementia, those ageing issues and illnesses. Or it may occur when an older person enters an abusive relationship. Aged care facilities are have a mandatory reporting requirement under the Aged Care Act. Once again, I indicated the relationship between a resident and a care provider is considered a domestic relationship. A lot of people that work in that industry are not aware that their relationship is deemed domestic, and therefore any offences they commit are covered under the Crimes, Domestic and Personal Violence Act of 2007. In relation to them being mandatory reporters, that comes under the Aged Care Act of 1997, where they are compulsorily required to report reportable assaults. A reportable assault is deemed an unreasonable use of force on a resident, ranging from deliberate and violent physical attacks on residents to the use of unwanted physical force, or it could be unlawful sexual contact, meaning any sexual contact with a resident without consent. Staff must make a report based on a suspicion or allegation. They must make a report if they suspect that a reportable assault may have occurred, or if they witnessed or have been informed of an alleged or suspected assault. And this report must be made within 24 hours, both to police and the Commission. Have a look here at the relationship of abusers, and that's why we can see, obviously it's predominantly family members, and that's why most of elder abuse is a domestic matter. Some of the barriers to reporting are similar to other domestic violence barriers, or reporting in those instances, but in particular with old people, fear of repercussions such as being placed in a residential aged care facility, denial or disbelief that abuse is happening to them. The older person is unaware of their rights, they're ashamed to disclose the abuse, or previous inaction or action that did not work. They might have cultural influences that create a barrier. A fear of being accused of lying or not being believed. They have a dependence on the person, similar to an adult-child relationship. It turns the other way around. So as I said, they might have a dependence on the person who is abusing them. There might be family conflict. They might have a cognitive impairment. They might be non-verbal or have other medical conditions that restrict them from accessing services to report the matter. They might be isolated. They might have a lack of knowledge of the available support services, or a fear of retribution or punishment. Just like to play a short video.
Now, I want to show you a film about abuse. And we all know what abuse means. It's pain, damage, sadness, or neglect. But this time it's not alcohol, drug, or child abuse. It's something that most of you probably never even heard of. It's elder abuse, the psychological, physical, financial, or sexual abuse of older people by someone they trust. And it's happening behind closed doors right here in Australia every single day.
Dad, I've decided I don't want you around the kids anymore. I don't like it. They don't like it. You scared them. You'll have to stay in your room from now on. It doesn't feel like you're my dad at all. I don't even want to invite my mates around because you embarrass me. Just sitting there. You look disgusting. Man, I hate having you here. I hate it. If I could afford to get you out of here, Dad, believe me, I'd do it just like that. You think I want you clogging up my house? And do you think that because you brought me up, I owe you this? Wasting my life looking after you? You're so pathetic! Look at you! Look at you! Look what you do to me! You drive me insane! Get up! Get up! So you can't even do anything for yourself! It's like looking after a freaking child! It's like a little baby! No one gives a shit about you, Dad! No one! And especially not me! I'm sick of this! You simply exist! You're just a waste! You're just a waste of space! You're nothing! You're absolutely nothing!
It's a huge and growing problem. We have to find them and help them. Please, pick up the phone. Call 1-800.
So that's where my role comes in, obviously to prevent things like that. And here's my contact details, and thank you very much for having me here today.
Thank you so much for such a powerful presentation. Ruth, thank you very much for the work that you do. I guess on a similar note, we have to remember those most vulnerable, our elderly people, people experiencing a disability, and also to lead us into our next section, children and young people. Children and young people are not bystanders to violence in their homes. So it gives me great pleasure to introduce Mina Johnson, Program Manager at Wesley Youth Accommodation Service. Is she ready to stream? Wesley is the SHS provider in Coffs Harbour. This is our final session, so we'll come, and I guess what a way to end with such a dynamic and formidable woman. Welcome, Mina.
Hello, everyone. How's everyone? Sorry, I'm just having some technical difficulties trying to organize my PowerPoint. Just bear with me. Okay, I think I'm good to, can you hear me? Okay, so thank you for inviting me to be part of this forum, and sorry, still not coming. Okay, so I'm going to talk about, from a youth perspective, what the impacts and what it actually means, domestic and family violence. But before I start, I want to acknowledge the traditional owners of the land where we meet, live and work. I pay my respects to elders, past, present and emerging, and the elders from other communities I may visit and walk beside. I recognize their connection to country and their role in caring for and maintaining country over thousands of years. I extend that respect to any Indigenous peoples joining us here today. I also want to acknowledge the many victims and survivors of domestic and family violence across the country. Their stories must be recognized to prevent future occurrences and the homelessness that often occurs as a result of violence within the home. So just a brief organizational information. So I manage Wesley Youth Accommodation Services, which cover Coffs, Ballingen and Nambucca. This is just one of our Do All the Good You Can mission statement. Just a brief overview of what our services provide. So we've got 5 different services running under our service here in Coffs Harbour. Another small little snapshot of what our specialist homeless services and our high-up services do under this service. So I just did not want to go too much into the information about my service because I want to focus on domestic and family violence. So I'm quite sure, seeing that I'm the last presenter, everyone would have heard different perspectives perspectives, points about domestic and family violence. So it's no surprise that it covers all these different areas. And I'm quite sure all the amazing presenters before me has actually spoken in detail about what this looks like, how it impacts, and what services are out there. Just a small little snapshot, last homelessness census, 80% for women and children and youth under 24 years of age, with the domestic and family violence as the main reason. And 42% of clients receiving specialist homeless services were experiencing domestic and family violence. In our own service, in the last financial year, 31% of our under 16s actually identified domestic and family violence as the main reason for seeking support from our service. That's a very high number. I'm talking between 12 and 15 years of age. And on the other side, the 16 years to 25, 26% of our clients actually identified the main reason that they were seeking support from our service was domestic and family violence. This is when they are actually identifying domestic and family violence as the main reason. But in all reality, the percentage of clients with domestic and family violence as one of the presenting reasons is as high as 60%. So that is a very, very big statistic. And we see up here at our service, we see so many clients, the impacts it has on them, the family breakdowns, the couch surfing, and sometimes some of them actually continue to live in that environment because they've got no other options. Which leads me to the next, they choose to stay with the violent family members because there's nowhere else to go. I can tell you of a young person who came in there who was actually sleeping rough in the school grounds for 2 weeks before he was found by one of the teachers. And we asked, why didn't he come up and talk? He said he was so embarrassed because there was no way he could live at home. The violence at home was getting unbearable. And he was so keen to further his education that he chose to stay in the school grounds and do his homework. So that's just one example of hundreds of examples I can give today. End up in other unsafe environments. When things are bad at home, sometimes we find the young people that are presenting, they actually say that they've actually gone and stayed at a place where they were it was more frightening because they realized that, and I'll give you a real example, that they didn't realize that the place that they had actually gone to get some shelter was actually a drug house. So that's another very big example of young people in DFE environments. One of the things, I don't know, this is again something that we have actually experienced when we are speaking to young people. We find that some of them think that that's a normal behavior. And they don't realize probably that there is anything different till they actually come in contact with somebody else who actually looks at them and go, no, that's not normal. That's actually emotional or, mental or abuse. It's amazing that young people's definition of abuse and where it takes them, depending on what environment they actually live in. And on top of that, they actually develop very unhealthy coping strategies. How do they deal with it? How do they go, yes, mother and father are in a domestic and family violence situation, but they don't know where they stand. One young person said that every time they starting hear an argument, they would put headphones on and imagine that they were actually having a holiday somewhere else. One of the things also is that, some of them learn that as a normal behavior, and they actually, when they come to our crisis refuge here, some of the times we find their behavior is reflecting of what they've actually been into. So so these are some of the examples of what young people in domestic and family violence environments think is normal. One of the things I do want to talk about, and which is something that we have seen a lot in our service, the LGBTQI plus domestic and family violence and the effects. I know we've had presentation from ACON, and some of these things that we've actually taken from their website, but I want to give you a simple case study. I always think the power of getting the message across is actually talking about a real story, so people understand the impacts. So I'm going to talk about a young person, was born a female, but identified himself as a male. He had a very toxic family environment, to a point that his family would not accept. His family would not accept that he wanted to be identified as a male. They would not even talk to him about, did not want to even think about hormone replacement therapy or anything that he wanted to do, to a point that he started getting physically and emotionally abused at home. When he came to our service, he didn't know what to do. He did not know what supports were there to support him. He was struggling with his own identity, with his own feelings, and also the need to connect to his own family. When he left the home, his parents did not want him to have any kind of relationship with the other siblings, which really impacted on this young person's mental health. And that is on top of absolutely feeling isolated and not knowing where to go. So when he first came to our refuge, he was very upset. One thing he was very sure about, that he wanted to be identified as a male. His journey is very inspirational to us, because he has gone from a lost soul coming to our refuge, not knowing what to do. And in the last 3 years, he has actually gone through the gender, he went into the hormone replacement therapy. He's actually had some operations. He is absolutely amazing. He's in his own place where he is actually feeling supported. He actually has a voice now in what he wants for the LGBTIQ community in regards to support. And he's also been instrumental in being one of the peer supports for a lot of these young people in our area. I'm just giving you a very brief snapshot. His journey has been pretty full on. I think one of the things that has come out of it is that now his family has started connecting with him again. He started connecting, especially with his other siblings, which has had a positive impact on him. And his self-esteem he just amazes us with how much he has to offer now than where he was when he first came to our service. So I just wanted to share this small little story so people can understand that, and one of the things is that he is like a role model for us, because he comes to us. He's also been very instrumental in some of the changes or some of the things we did as part of continuous improvement in our organization. So he was a great voice for us, a young voice for us to listen to and go, yes, there are things we need as part of continuous improvement in our organization, and how we can better support, how our staff can better support, or how management can deal and be better prepared to support any other young person coming with similar situations. So I just wanted to share that. This is again just a small little example of the violence and verbal threats, rape, conversion therapy, other conversation. This is all from the prior training that some of my staff have done. Yeah. I'm happy to answer any questions. I know it's the end of the day and everyone's had a very long day. I'm happy to take any questions if anybody has any. Hello?
Thank you so much, Mina. We've got people moderating the chat.
Hello?
We'll let you know if there's any questions we'll forward on. So this brings us to the end of today, to our conference. I really wanted to reiterate the 5 R's, that this is a way that we hope that can support you in your work with your clients and community, to know how to respond, to recognise, to assess the risk, to refer, but most importantly, as I said before, to restore. Please remember, we've had a lot of heavy content today. Take some time this afternoon to take care of yourself. Remember that you have the option to call 1-800-RESPECT if something has come up from today that has been has triggered you or is a little bit difficult. I want to have a big thanks to the Samaritans who have gone over and above with this fantastic facility they have here, the Kempsey Hub. And I also want to have a big thank you to everyone who came together to pull this off today. It's a real example of true collaboration. It started with conversations in interagencies like we all attend every day, from the District Homeless Implementation Group and the Child and Families. This was in response to the feedback we heard there, and it's developed from the words and the consultation that you gave us in those child and family meetings that we undertook. A really big thank you to David Larhoven from DCJ and from Joe Wallace from New South Wales Health and from the New South Wales Police, who have also come together to really guide us and support us to create a great agenda for today. I guess we all hope, on behalf of the people involved in this, in today, so that would be from Warina, from Samaritans, from Liberty. We hope that this is, I guess, an opportunity to further enhance those relationships that we do have with each other. 2020 has been, what a year. But I guess what we're really hopeful from is what we've learnt from this is we can get through anything. There is a huge commitment across our community to say no to domestic and family violence and to make sure that we're continuing to enhance safety within our families and communities. So please, if you don't have contact with your specialist services, you'll have our emails, I'm sure, from today's event. I want to let you know also that your local resources are now available to download from the website where you registered. And also you'll have access to that short film. So if you have colleagues who didn't get the opportunity to come today, those resources are designed to sit together so that they can have a little bit of a mini session. We're also going to provide the recordings of today's sessions and individualised packages, so that if there was something that you wanted to show in a team meeting or go back and listen to, those recordings will be available for you to use, and we'll send them out as soon as humanly possible. A very, very big thanks to Blue Sky Community Services. Without their support from the sector development space, this would not have happened. We would have struggled to know how to do this from any which way. Thank you to Nathan for running the technical support. If you could see this fantastic desk of plugs and lights and microphones that I can see, you'd be pretty impressed, I'd say. And a big thank you to Ashwater Film, who assisted in the production of the short film that accompanies the resource.
Thank you, and I presume I missed all the thank yous, but I just wanted to also acknowledge that we've all learned a lot today. I've been very moved by all the speakers that we've heard, and I guess what the takeaway for me is that we all have a role to play in preventing domestic and family violence, and that the big takeaway is keeping the door open and knowing that you have things that you can do and work alongside of your domestic and family violence specialist services. But thank you to everybody that's been part of organising the forum and presenting the forum, and we hope that you've got a lot out of it, and we're very happy it went so well and look forward to working with you all in the future. Thank you and enjoy your day.
Thank you.
Bye.